What are those 2 or 3 things that you can suggest a woman to maintain her fertility?
Age is something that's not in our control. Let's focus on things that are in our control.
Clarify on this point, difference between egg and embryo.
Okay, so that's the most basic of the question. What is an egg and what is an embryo? Egg is the...
How many eggs should a girl freeze?
Eggs depend on the age. Age is the one parameter that we use to assess the quality of eggs.
Dr. Shilpa Singhal. She has more than 13 years of experience in reproductive medicine, completed more than 700 IVF cycles, performed with live birth rates that match other tier 1 labs in Delhi.
In fact, आप ये भी समझिए कि एंडोमेट्रियोसिस इज लाइक अ दीमक इन द ओवरी. वो अंदर ही अंदर ओवरी के टिश्यू के अंदर अपने ब्लड क्लॉट्स को बढ़ाती चली जाती है एंड यू रियली कैन नॉट डू मच. येस, इफ यू आर हेल्दी, इफ यू आर डूइंग एक्सरसाइजेस रेगुलरली, मेंटली स्टेबल, देन योर ओवरी विल ऑल्सो बी टू सम एक्सटेंट बेटर. बट अगर आप
how many embryos are enough?
Now this question is going to involve a very important concept. You know, that's a very tricky situation. Often the girls come up to me saying that, ma'am, we are very healthy. How come the AMH is low? Or how come we are not able to conceive? How come the eggs are spoiled?
मैंने ये भी सुना है that every embryo is a girl.
Absolutely. Every embryo at one stage is always a girl.
How much does it cost to get one cycle of IVF? And what about couples where one partner wants it and the other doesn't want it? What do you suggest to such couples? Hello, Dr. Shilpa. Most welcome. I am so glad you said yes to this podcast because today my intent is to help millions of girls who have a lot of concerns about their fertility through your help.
Thank you so much, Alina. It is really my pleasure to be here. And indeed, I hope to, on the same intent, to bring out, with your help, some information to the young girls out there who are actually driving for their career, wanting to achieve big in life, and at the same time feel fulfilled.
Let's start with the most basic question. What IVF is?
So that's a beautiful question. Now you're driving straight to the home point. So IVF is in vitro fertilization. So fertilization is a process where the egg and the sperm meet each other and fuse to form an embryo.
Right.
That's fertilization.
Right.
When it's happening inside the body, it's in vivo. When it's happening outside the body, it's called in vitro.
Okay.
So anything that's happening outside the body, in a lab, in an artificial setup, is called in vitro conditions. So when we take the sperm and the egg outside the body, allow them to fuse and form an embryo, that's called in vitro fertilization or IVF.
Okay. इसी को test tube baby बोलते थे क्या?
Yes, that's okay. So there's an interesting story. When the IVF procedure started, or rather artificial reproduction started, they were initially started with a process called IUI, in uterine insemination, in which the semen was collected outside the body and in a test tube. It was processed and then inserted into the vagina or the uterus of the female in the 1980s. Now at that time, this was the only beginning procedure that we had, and it resulted in live pregnancies. Now since the test tube was used to conceive the baby, these were called test tube babies. And hence we now even call those procedures, although that's a simpler form of ART, but that's also a process where test tubes are used. So technically test tube baby is more like IUIs, but yes, extension of those are IVF babies.
Where do you stand with an ethical standpoint? Like कुछ लोग इसको unnatural मानते हैं और कहते हैं कि ये सही तरीका नहीं है. अभी भी मैं कभी-कभी Instagram पे ऐसे कुछ लोगों की comments पढ़ती हूँ कि this should be stopped, this should be banned, ये वो. I'm totally not in favor of those people, but I want to know where you ethically stand on this point.
Fair enough. So here I'll use something that even I received along my way of learning the IVF process. So आपने कभी पहले गए होंगे पुराणों में, अपने गीता पढ़ी, महाभारत पढ़ी, तो महाभारत में कभी भी बच्चा नेचुरली नहीं होता था. आपने देखा कि कभी यज्ञ हुआ and one apple was given and it was split into 2 parts and somebody was born. And या फिर हमने धरती में से एक small baby retrieve की and now we named her Sita Mata. And so there have been unnatural cases of birth even before what we see today. And so similarly, it's nobody says, or nowhere in our culture it says that the only way of giving birth is a man and a woman physically meeting each other. So similarly, आज भी अगर birth and death की बात करें, nobody at the human being level can actually let that happen. Birth and death is very much forces beyond our control.
True.
So what we do in our lab, जो मैं commonly अपने patients को भी बताती हूँ, कि it's a matter of creating bodies. We fuse two single cell gametes, that is called half a cell, to make one complete cell. That is our we have 46 chromosomes in all our cells, and one egg or one sperm individually have roughly 23 chromosomes in them. That is half of 46. So the two have to fuse to make a complete cell called an embryo.
Okay.
So this process of fusion takes place in the lab and gives rise to a structure or a cell structure that's an embryo. This embryo is nowhere a living organism. It's just a group of cells जो हम otherwise भी tissue culture में करते हैं. This is not a baby, this is not life, this is nothing. We are creating a condition outside the body that when transferred in the body can help the patient conceive. It is not at all that we are anywhere meddling with the natural pregnancy. When the fusion occurs, that is the sperm and the egg meet each other, they are not happening right in front of our eyes, even though we have technology to look at it. The process is so subtle, so uncontrollable that we can only observe it. We cannot control it in the extent that which two sperm and egg would actually fuse to make an embryo, nobody can predict. To a 100% success rate. There can be predictors here and there, but not a complete prediction cannot happen. And hence, we are facilitating the condition, but the events are happening by themselves. It is very much a natural form of pregnancy. There is nothing unnatural about it. Yes, unconventional, I can agree, but not unnatural.
I like that point.
So, yes, this has happened earlier in our own mythology. Mythology talks a lot about it. So, it's up to us how we want to look at things. But I definitely feel that this is nowhere unnatural.
And you cannot take away from the advantages it brings, right?
Absolutely.
Immense advantages, immense independence, so much peace of mind.
Independence, peace of mind, yes, but talk to a couple struggling for fertility even for 6 months nowadays. Young couples have no patience. Even 6 months becomes such a big difficult time for them that हमारी शादी ही लेट हुई, अब हमें और wait नहीं करना है. We want to get pregnant as soon as possible. And even if I ask them to wait for 2 months, it becomes difficult for them. And also a couple who's been trying for baby for 10 years and they come to us with so much of hope that please, we want to see that experience of motherhood, of parenthood. That's so important, so pertinent. At the end of the day, the life is about experiences. Life is about, pregnancy is part of emotions. It's about, family comes first in everybody's list usually. So, pregnancy is a natural outcome of a marriage. Like everybody wants to get married, an eventual outcome, everybody considers it to be a pregnancy and have a creation that's something contributed by both the husband and the wife. When you look at those couples, they are just yearning for it. That experience, that knowing that beta HCG report is positive, that one point in their life is so important. They come for that. And the moment they see it, they feel so happy. It's just that life just completely fulfilled for them. That's all they are looking for. So I think looking at them, I really feel that this is a blessing. I see in no way that we are meddling with life. We are doing things that are unnatural. Not at all. It is very important.
And how amazing it must be for you to announce to them that here it is, it's a positive.
It is divine. That moment, you somehow feel so happy and so completed. You suddenly feel purposeful. Like you've really helped somebody fulfill their life dream. That's a feeling I cannot talk about. In fact, it's so this thing that sometimes the couple takes a time to really realize that, okay, this has happened. They take a while to let it sink in. Some are really ecstatic, some are crying. It's just a different feeling for them. And yes, even then the wait is for another 8.5, 9 months. They have to wait for that time for that baby to actually be in their arms and in their life. But yes, that's the beginning.
Yeah.
So it's truly difficult.
So I think we are pretty clear on the point कि भाई इसमें भले ही unconventional है, थोड़ा less traditional है, modern है, but at the same time things are still happening with their own will. इसमें आपकी will बस इतनी थी कि आपने दो चीज़ों को mix कर दिया, आगे उसके बाद फिर नेचर को ही अपना कोर्स लेना है वहाँ पे.
So that's absolutely true. So we have certain parameters where we say ki what is the kind of embryo that we are putting in, what is the condition of uterus, what is the condition of pelvis, the quality of the sperm and the egg, and to a certain level, yes, they are important. There are times when we can predict that ye to nahi hoga, but mostly even after we've done our the best to the embryos and the uterus, we have put the total best embryos, grade A embryos, expanded embryos typically that we have in our lab, perfect ones, PGT tested. The uterus is absolutely wonderful, beautiful lining, triple layer, and we are like, yes, we've done a great job, we've done a beautiful placement, everything is on point, and still we have to, lo and behold, wait for another 15 days. Me, the doctor who is doing it, and the patient who is receiving it, both are on the waiting end for the next 15 days after doing an embryo transfer. That's the point of surrender. We've done our best, but whether this pregnancy will turn out into a live pregnancy, whether this transfer would result in a baby, is something nobody can predict. Not the best of the doctor, not the senior most doctor with 15, 20, 25 years of experience can also not predict, but just stay there and wait and watch for that result.
That brings me to my another very important question. What are the chances of it to be a successful transfer? Like mathematically,
so we're looking at conditions given that we have an embryo. So most of the cases we don't do genetic testing. So let's start there, where the embryo is morphologically good graded embryo. Grade
How do
A.
you know that?
So when the embryologist and clinician is a team, they both work in the lab together and they look at the embryos, the way it has grown over the last 5 days to create a blastocyst on day 5.
I will come to my next question later, what a blastocyst is.
Absolutely, that's a big topic. And so when an embryo is created, the way it grows, that's the kinetics of the embryo, and the way it looks to the eye under a microscope. How clear is it, or how grainy is it? What is the color of the embryo, whether it's brownish or it's whitish, it's pearly white or not? And then what is the regularity, or how clear the cells are, how similar the cells are. That is how we decide whether the embryo is morphologically and kinetically good. A good embryo formed at the right hours from the pickup to 172 hours, say for example, is what we consider for the embryo to be a proper grade A embryo. And then those embryos, when placed in a uterus with a good lining, say what I mean is the volume should be good, the vascularity of the uterus is to be good, and the thickness of the endometrium is to be good. When those conditions are fulfilled, the success rate of an embryo transfer is roughly between 70-75% across the nation and also worldwide. In fact, if you look at the literature and data, nobody says more than 50-60%. Even though we vouch every time we go for an embryo transfer, we are looking for 100% success rate for every patient. We have to go and agree that yes, one single cycle success is roughly between somewhere around 70%, if I talk about being very optimistically.
And you're talking about one embryo transfer, two
embryo
4.
transfer. This is a dual embryo transfer that we usually practice because that's the safest bid. If we get a twin pregnancy, that's something that we can manage without compromising the baby status. And if we go for single embryo, it's good. We don't place more than 2 embryos. That is
risky.
It's very, very risky to the embryos and the mother. We end up having no pregnancy at all. beyond a certain point, so no point doing that. We are moving towards single embryo transfer nowadays. Many of us are aiming to a single live healthy pregnancy. It does take off 5% success rate, but usually the results are nowadays very good. In a competent lab, at the hand of a competent embryologist
Surgeon.
and clinician, you get decently good success rate with a single embryo transfer. That's what the world is now going for. Outside India, mostly people are doing single embryo transfers. India, still many of us are doing double embryo transfers, but we are definitely moving towards
Single embryo transfer.
That's how beautifully the things have evolved.
So this would be 65-70% success rate.
In one cycle, yes.
And the quality of embryo is also really important.
Very, very important.
If the quality is not too good, then what happens?
Still, see, if the quality may not be grade A, it might be grade A to B or somewhere between B. Till that time, we still want to give a trial to that embryo, especially if no previous transfers have happened. We never know. We cannot really predict by precision saying that we are transferring a B grade embryo, it will not give us pregnancy. Yes, a C grade embryo definitely will not give us pregnancy. We are very sure of that.
But do you even store a C grade one?
No, we don't.
You don't store it.
No
then,
point
right?
giving unnecessary. It increases the burden in the lab. And galat umeed, false hopes. And see, we have to be conscious for the planet also. What we are storing on the planet, why do we have to store it? There is no point. We have to be, we just had a Earth Day 2 days back. So thinking about the planet also, we have to make it, the lab has to be conscious to what we are doing towards the planet.
It will be safe to say that if there's any storing happening anywhere of an embryo, that means the embryo is good.
Yes. So I'm assuming the lab is good. We have to know where we are storing the embryos. But yes, anywhere the embryo is being stored, it is technically giving us a success rate more than 50%. Only then they are going to plan to store that embryo. Otherwise, there's no point storing it.
Very important next question everybody would want to know is how many embryos are enough? I've asked this question so many times to my AI device everywhere, but I would want to hear it from you.
Fair enough.
Where you are on this.
So, now this question is going to involve a very important concept of aneuploidies. As we are, so I just told you, every egg has a 23 chromosome structure and it converts into a 46 chromosome structure the moment it fertilizes with a sperm. The sperm only contributes the DNA to the embryo. The basic structure of the whole process of fertilization is on the shoulders of the egg. So always the egg has a bigger role to play when it comes to fertilization and creation of an embryo. The better quality the egg is, the better the cytoplasm and the mitochondria are going to be. As a result, the process of making 23 into 46 chromosome, that process has a lot of errors into it. That errors are taken care by the egg. If the egg is competent, the ability of the egg to take care of those errors and give a competent embryo, genetically competent embryo is very high. But if the egg is incompetent or aged embryo, the ability of the egg to make a competent embryo is less. That is why it will depend on what age of the egg or the age of the lady when I'm taking the egg from her will decide the number of embryos I need to give me a decently good enough success probability at a later age. A girl, a woman at 20s, 25, 30s, the egg is competent because an enzyme called telomerase is very active. It takes care of the errors that are occurring during the fertilization and hence the embryo is genetically competent. And that is why at that age, less than 30, even 4 eggs are sufficient to give us a healthy pregnancy with a probability of almost 80 to 85%. But at an age of 35, it goes a little down. I probably would need 1 more embryo at that point. And when I come down to 38 and 40, when the telomerase enzyme is really gone down in its action and the egg is producing incompetent embryo very frequently, that is the time when I really need more embryos in hand. And the tricky part is the already egg number is down. And it's difficult to get even 2 embryos by 2 or 3 cycles. And that is where it becomes very difficult. We are looking at some 6, 8, 10 embryos, but the eggs are already less, and it's the most difficult situation. Very recently, we did almost nowadays, because PGT is the genetic testing of the embryo, pre-genetic testing of the embryo, pre-implantation genetic testing is PGT. This is done to ensure whether the embryo is genetically competent. When I'm talking about genetically competent embryo, I'm seeing whether the chromosome structure is normal or not. If I look at an age of 38, 39, 40 to 42, that bracket of 38 to 42, there is a bigger chance of an embryo coming out to be abnormal.
But then you won't store it, right?
Then I will not. I might store it initially. Once I get the test result and I realize that yes, they are not competent, I will never transfer them. And then probably discard them.
At what stage do you get to know that you have to discard it or hold it?
So once I do the egg, first I make the embryo. I send them sample for testing. The test comes back after a period of 21 days to 28 days. Okay. That is the time when the embryo is there with us. Once I have the result, I understand whether I can go ahead with transfer or are they not competent. If they are not competent, then I am supposed to discard them.
Oh, so all of this will take about a month and you'll have your decision. I can imagine. Getting 6 to 8 embryos out of a 38, 39-year-old, I can imagine, because if you retrieve 10 eggs, a fair chance would be to get 2 embryos out of it, right? After blastocyst?
Yes.
From whatever I have read about it.
Absolutely.
So that means if you're looking at 8, oh my God, I can't even imagine 80 eggs. It's impossible to get it out of.
That's the reason.
Oh my God.
And that's where, having said that, so there have been circumstances, there have been cases with us where we've done an egg pickup at 40, at 42. 42, the lady, she had only 3 embryos, that too only on day 3. There was no chance that we could take them to day 5. There was no point doing that. We knew that we would not end up having any transfers. We simply transferred 2 day 3 embryos for this 42-year-old lady. And yes, she did conceive. She delivered a baby. And so that's how miraculous and unpredictable this science is. And hence I say I don't do anything, or any doctor doesn't do anything. We are all a medium to the whole process. It's what is there in the destiny of the couple. I somehow do allow those forces to come in and suggest and let them take over and guide us in the process. So if that child is written to be born, the child will born. It will come.
And this lady, 42-year-old you were just talking about, was she physically fit, healthy?
Yes, she was physically fit. Absolutely
not
fit.
Overweight?
Not at all. She had a good BMI. She was regularly working out. No bad history of any smoking, alcohol, nothing. Very nicely done. You wouldn't really say she's 42 years. That's true. And so that was one reason that might have helped her.
Because I've read that these things play a very important role in pregnancy and conceiving.
See, the things have changed, times have changed. Even at 39, 30, 40, people don't feel they are 39, 40 if they take good care of themselves.
Most people do.
Most people do nowadays. And if you're taking good care, but then, that's a very tricky situation. Often the girls come up to me saying that, ma'am, we are very healthy. We take good care of ourselves. We do yoga daily. We eat healthy and we are absolutely wonderful. How come the AMH is low, or how come we're not able to conceive? How come the eggs are fault? Like, we do everything good. So yes, it ensures that you're not putting more burden on your eggs. You are to some extent taking care of the quality.
Yeah.
But having said that, age is the most important factor. Even if you're doing everything right, you're eating healthy, you're not smoking, you're not taking alcohol, you're exercising regularly, you take care of your mental well-being, even then, there is not saying that, yes, you can be fit enough to have your own eggs to get a pregnancy at 40.
This is the beauty of life, the unpredictability.
That is how it is, yes. And in fact, mostly girls nowadays, even at 30, are coming up to me with reports of very low AMH, 0.2, 0.1. And many of them are not even married and still, finding out their path in life. So it does pain at that point that why is this happening? Is the society undergoing some sort of a change in terms of women fertility? or probably it is just some odd cases coming to light because of advanced testing now available with us. It's difficult to say, but definitely these girls are now coming up in more number in our everyday OPDs.
Younger girls.
At 30s, you don't expect an AMH report of less than 0.5, but you still see them.
Less than 0.5 is very low.
Very low at 30, 32. You don't expect those kind of reports.
What is a normal AMH at 30, 32?
That's a very good question. So roughly the normal value of AMH is somewhere between 2 to 5.
2 to 5.
And when it starts going less than 1.2, we start seeing it as a low AMH. And this, so let's talk a little bit about eggs. How are they formed? So eggs are genetic, present in any woman's body by birth. When the girl is born, there is roughly 7 million eggs in her body. Eventually, by the time she reaches puberty, around 11-12 years, that's when they come down to some 3-4 millions. And with every menstrual cycle, some 100 eggs are released, out of which 1 matures and 99 degrades. That's how slowly by age, these egg count go down. And coming to a point when by 38, 40s, roughly thousands of them remain behind, which are now going to be released, but most of them are not going to be very good quality. So this number of eggs that are present in the body can be tested by this test called AMH. That's an anti-Mullerian hormone blood test that is done any day of the cycle. Usually doesn't need to be any particular day, and you can understand where do you stand in terms of number of eggs available in the ovary to give you pregnancy. It's a surrogate marker to look for the number of eggs present. So at the age of 30, I would expect an AMH to be around 2. Around 32, 33, it drops down to 1.5. 35, 36, it's roughly 1.2. 37, 38, roughly 0.7, 0.8. And by 40s, it's somewhere around the age level of 0.5 to 0.4.
So AMH is the quantity of eggs and not quality.
So you need to understand both usually go hand in hand. When the quantity is more, the quality is expected to be more. And when the quantity goes down at the age of 38, 40, the quality is supposed to go down. But they both may not help each other. For example, PCOS girls, normally, typically the eggs are very high in number. Say 20 eggs per ovary. More eggs per ovary. But sometimes
every cycle,
the quality is very poor. And then there can be girls with low AMH at young age. Say 32 age, but AMH 0.5. I will still get a much better quality eggs rather than 40 years AMH 2. So age is a better predictor of quality rather than
your
AMH.
conditions, the conditions of your body, your uterus.
The AMH I would quantify, I will use AMH to give me the number of eggs that I might get, but not for the quality.
Okay.
It's difficult to generalize that if the AMH is good, the quality is going to be good. If, for example, your AMH is good, but you've been trying to conceive for the last 2 years and with every other factor being normal, there is a possibility that the egg quality is not so good. How can you just predict based on the AMH? So all these, so whenever you go to a fertility doctor, they will not simply look at the AMH value. They will look at your age, they will look at your AMH value, they will look at your follicular count or the antral count, and then they will look at all other conditions, whether something else is also present.
Okay.
So it's never one single factor that will tell you the quality of the egg.
And I think we haven't yet discussed this very important term, endometriosis.
Yes.
Which is, I think, very common.
The prevalence of endometriosis is roughly 10% of the entire infertility population. Some might have it mild, some might have it severe, but it is more prevalent in the infertility population compared to a general female population.
Okay.
Endometriosis is basically an inflammatory condition. मैं ऐसे बोलती हूँ जैसे कि जंग छिड़ी हुई है आपके पेल्विस के अंदर. यूट्रस और उसके आसपास के एरिया में बहुत सारे इन्फ्लेमेटरी मार्कर्स अक्यूमुलेट हो जाते हैं क्योंकि जो आपका नॉर्मल यूट्रस के अंदर का टिश्यू है वो अपनी जगह छोड़ के बाहर आ गया है. यूट्रस की वॉल्स के अंदर, यूट्रस के बाहर, ओवरीज के आसपास, ट्यूब्स के आसपास आके डिपॉजिट हो जाता है, जो उसकी नॉर्मल प्लेस नहीं है। क्योंकि वो उसकी नॉर्मल प्लेस नहीं है, तो इसलिए वहाँ पे आने के बाद वो वहाँ पे इरिटेशन कॉज करता है वहाँ के नॉर्मल स्ट्रक्चर्स को। हेंस लॉट ऑफ इन्फ्लेमेशन गोज ऑन. We have read so many times or at so many places that inflammation is never healthy in any part of the body. Similarly, endometriosis means a inflammation is going on in your body. Yeah, it has a potential of causing inflammation. कभी भी आप स्ट्रेस में आए, जैसे पूरी बॉडी में कॉर्टिजोल बढ़ा, वैसे ही वहाँ पे भी कॉर्टिजोल बढ़ जाएगा, इन्फ्लेमेशन बढ़ जाएगी, यू विल हैव प्रॉब्लम्स. इन्फ्लेमेशन का मतलब है कि जब भी कोई जंग होती है, किसी के लिए भला नहीं होता है. तो ना तो वो एंडोमेट्रियल स्पेस जो वहाँ पे आ गई है उसके लिए अच्छा है, ना बॉडी के नॉर्मल सेल्स के लिए अच्छा है. इस पूरी जंग में हमारी ओवरी सफ़र करती है, हमारी ट्यूब सफ़र करती हैं, ट्यूब्स चिपक जाती हैं यूट्रस के पीछे जाके, ओवरीज यूट्रस के पीछे जाके चिपक जाती हैं. जो एग बनता है उसकी क्वालिटी डाउन हो जाती है. एंड हेंस ऑल्सो द एग दैट इज रिलीज्ड फ्रॉम देयर इज नॉट नाउ have a natural relationship. There's something called a tubo-ovarian relationship कि एग रिलीज हुआ ओवरी से और वो ट्यूब के अंदर आ गया. वो जो एक नॉर्मल प्रोसेस होना चाहिए था वो डिस्टर्ब हो गया. तो अब वो ओवरी से निकला हुआ एग ट्यूब में आ ही नहीं पाता है, फर्टिलाइज ही नहीं हो पाता है, और उस एग की कॉम्पिटेंसी भी कम हो जाती है बिकॉज इन्फॉर्मेशन ऑल दैट इज गोइंग अराउंड इट. हेंस द चांसेस ऑफ प्रेगनेंसी गो डाउन इन दीज पेशेंट्स.
तो सही टाइम पे सही जगह पहुंच ही नहीं पा रहा है.
नहीं पहुंच पा रहा है.
ज्यादातर एग्स लूज हो जाते हैं ऐसे ही.
एब्सोल्युटली. इनफैक्ट आप ये भी समझिए कि एंडोमेट्रियोसिस इज लाइक अ दीमक इन द ओवरी. वो अंदर ही अंदर ओवरी के टिश्यू के अंदर अपने ब्लड क्लॉट्स को बढ़ाती चली जाती है. एंड यू रियली कैन नॉट डू मच. येस, इफ यू आर हेल्दी, इफ यू आर डूइंग एक्सरसाइजेज रेगुलरली, मेंटली स्टेबल, वेरी शांत जिसे हम कहते हैं, तो देन your ovary will also be to some extent better. But अगर आप परेशान हो, going through struggles in life, you are already in a very bad shape, stressful situation, then it will again arise up, flare up, multiple episodes leading to fulminant condition. Not good for the fertility to happen.
इसका कोई इलाज है endometriosis का?
So it would not be wrong to say it's a lifelong condition. Yes, to some extent we are worried about the fertility aspect. That is one part. So we should take care of the fertility as soon as possible. Second part, pain. People who have pain have a bad pain. It really affects the quality of life for these girls. And hence, वहाँ पे surgery भी कभी कभी help नहीं करती है. But eventually we might have to go for removal of the endometriotic cyst, correction of all the implants that are there. वो सब areas को clean किया जाता है at the hands of a good expert. तो the lady can feel some respite. But it is definitely a tricky situation.
And is there a way to prevent that from happening?
There is no way.
इस पे कोई control नहीं है women का?
नहीं.
मतलब
सो अगेन सी लाइफ में ना कंट्रोल इज़ अ वेरी ट्रिकी वर्ड. आई फील कि हम कैंसर है, हम कहते हैं कि हम प्लास्टिक नहीं यूज़ करेंगे, हम ये नहीं करेंगे, वो नहीं करेंगे, बट फिर भी कैंसर पे आपका कोई कंट्रोल है नहीं है. सिमिलरली इट्स अबाउट दीज थिंग्स आर ऑल्सो इन्फ्लेमेशन बेस्ड थिंग्स. कब आपकी बॉडी में इन्फ्लेमेशन शुरू होगी आपके कंट्रोल में नहीं है. बट इन जनरल इफ़ यू हैव अ गुड लाइफ स्टाइल देयर आर चांसेस कि वो नहीं फ्लेयर अप हो. बट अगेन उसकी एग्जैक्टली क्या इटियोपैथोलॉजी है, क्या आपकी फैमिली में जेनेटिक्स थी जो आपके रन कर रही है, क्या वो जीन्स एक्टिव हैं, देयर आर सो मच मोर देयर टू बी येट फाउंड आउट दैट इट्स वेरी डिफिकल्ट टू से कि किसको होगा किसको नहीं होगा, या वेदर यू कैन कंट्रोल इट फ्रॉम हैपनिंग टू यू.
And most people don't even know जिनको होता है. They don't even ever find.
So yes, the diagnosis endometriosis takes time for young girls. Every time the girl has a period and she feels that pain है, तो she is usually brushed around saying कि ये तो normal है. But then there are degrees of pain that a girl needs to understand, and the family needs to understand. The mother needs to know that the girl is not making up excuses to miss school. If she really has pain and she's not able to go to school, मतलब कि it's something serious, then they do need to visit a gynecologist, understand the situation, see what options are available, and then accordingly take decisions. There are girls nowadays when they go to gynecologist, they are being undergoing testing, and those who have grade 3, grade 4 endometriosis, they are being referred to us for egg freezing, because we know that another 5-10 years down, 5-10 years down the line, they are going to have a problem with egg quality and quantity. And so they are advised egg freezing by their gynecologist nowadays. And the earlier that's done, the better. We've had girls at 20s, 22, still studying, not planning pregnancy or marriage even, and they're coming in for egg freezing because they now are being told about this. The awareness is there in the gynecologists themselves, in the community, that they can educate and help these girls out. That's the only prevention and awareness that we can do.
ये सारी चीज़ें पहले भी होती होंगी एंडोमेट्रियोसिस, बट हमें इनफर्टिलिटी नहीं देखने को मिलती थी ना पहले इतनी.
तो पहले शादी हो जाती थी 17-18 पे, बच्चे हो जाते थे. So by the time the estrogen starts taking its toll on the body, the family is actually gone through the fertility aspect as it is. So the 1 or 2 generation before us, they actually did not really have to deal with it much because of the same reason. Pain hota tha, which used to be brushed aside. And at the same time, ज़्यादा होता था, family complete, hysterectomy done, ovaries removed, and most of it taken care by that time. Now that we are looking at different aspect of life, the way we are living our lives, doing our education by 30-35, and then planning of marriages and not even sure about the babies, that is where our generation comes into picture. The generation is very different nowadays.
Is there something wrong about them, according to you?
Not at all. It's just about being aware. See, when nowadays, earlier, girls used to suffer so much. When it came to marriage, the whole burden was on the girl. Now, both the partners are equally sharing the burden.
Yes.
Everything has, the perspective toward every situation in life has changed. Similarly, we want the control to be in our own hands. We want to ensure कि इस एज तक हमें पढ़ाई करनी है, इस एज पे एक डिसेंट लाइफ बनानी है, एजुकेशन चाहिए, इतना घूमना है, इतनी चीज़ें अचीव करनी है. वी आर डूइंग ऑल दैट. सिमिलरली, अगर हमें पता है कि इस टाइम के बाद ये टाइम दिक्कत आएगी, हमें हमारी फर्टिलिटी पता है, वी नो दैट फर्टिलिटी इज़ एट पीक बिटवीन 20 to 30. मैं अभी नहीं कर रही हूँ, 30 के बाद जाके करूँगी तो मेरी डेफिनेटली AMH कम होगा, एग क्वालिटी डाउन जाएगी. अगर तो मैंने 30-35 में प्लान कर लिया है, टेस्ट करवा लिया है, सब कुछ ओके है, आई कैन रिलैक्स, डू व्हाट आई वांट एंड कम बैक एंड लुक एट दैट एस्पेक्ट ऑफ लाइफ लेटर ऑन. बट मान लीजिए मैंने नहीं किया, आई वांट टू एंजॉय लाइफ एंड आई हैव नो प्लान्स ऑफ गेटिंग मैरिड बाय 35. तो I can absolutely go ahead, get my eggs frozen, keep them as a safe insurance, enjoy life, and come back later on saying that now I want to conceive. Please give me a chance.
Okay.
At least a chance would be there. I'm not saying every girl would be able to achieve pregnancy even then after that, but at least you have some backup.
How many eggs should a girl freeze?
Good question. So again, that question brings us back to the fact that eggs depend on the age. Age is the one parameter that we use to assess the quality of eggs, because we don't know how these eggs will eventually convert into embryo.
A lot is lost on the way.
On the way, yes. So we might have 10 eggs, we might have only 2 or 1 embryo, we might have 4 eggs, we might have 4 embryos. We've seen both sides of the coin, trust me. And even we don't know how the egg is going to behave in the lab.
Wow.
Having said that, only thing that we can control is the condition in the lab. To be so immaculate that every egg is being given a proper and a decent opportunity to convert into an embryo. That is what I think good gynecologists or good fertility specialists ensure, that the lab is so up to date on every point that one embryo or one egg that is lying there in that incubator is given a fair chance to develop into an embryo. That is where the role comes in. So I don't know how that egg will turn out. So I always look at the age of the girl. If the age of the girl is less than 30, I can safely tell her that yes, please store some 8 to 10 eggs. You will be able to get 2 blastocysts or 4 blastocysts, and the pregnancy rate is decently between 70 to 80%. But if you are between 30 to 35, the recommended number is around 15. And
eggs.
Yes, not embryos, because we are not looking at
Doctor, I want you to please clarify on this point, difference between egg and embryo, because I understand, but there may be a lot of people who do not understand the difference.
Okay, so that's the most basic of the question. What is an egg and what is an embryo? Egg is the half a cell of the body that every woman is making in one menstrual cycle. We have stem cells in the body. Stem cells give rise to oogonia. These oogonia develop into a egg. Egg होता है आधा. एग्स को एक स्पर्म के साथ फ्यूज होना होता है, तभी वो
पूरा हो जाता है,
पूरा होके एम्ब्रियो बनता है. दैट एम्ब्रियो इज द कंप्लीट सेल 46 क्रोमोसोम जो ग्रो करके मल्टीप्लाई करके पहले 1 से 2 में होगा, 2 से 4 में होगा, 8 सेल पे जाएगा, कंपैक्शन, इनर सेल मास, ब्लास्टोसिस्ट, एंड इवेंचुअली इट विल ग्रो इनटू अ कंप्लीट बॉडी. सो वी ऑल ग्रो फ्रॉम जस्ट वन एग, one embryo. Sorry, we all grow from one embryo. Egg and sperm are the raw material to that embryo.
Okay, so egg is unfertilized, embryo is fertilized.
Absolutely.
This
Perfectly
is basic difference. So you can freeze your egg if you are single, and you can freeze an embryo if you are with a partner. It could be a married partner, it could be an unmarried partner, but it is safer if it is married.
Unmarried women can go for freezing of eggs. She can also opt for freezing of an embryo if she wants a donor sperm. Nowadays, known donors are also allowed. So hence she can use, as you just said, she can go for a tentative partner that she has in mind. She can use the sperm from that partner and go for an embryo formation even at a single status.
But later on, if you get married to somebody else, it might be a problem.
Absolutely.
Your partner may not allow कि भाई हम किसी और का बच्चा नहीं करना चाहते.
Yeah. You basically are giving up your autonomy basically.
Yeah, right.
If you have your eggs, they are definitely more wider options available to you.
Right.
Absolutely.
Because आप फिर किसी का भी डोनेशन ले सकते हो for that.
But यहाँ पे सिर्फ इतना सा ही एक क्लीशे है कि एग के साथ it's difficult to predict how the status is going to be. Even though this technology has improved, the vitrification process, the process of freezing the egg and the embryo has improved a lot. But embryo का survival is much more robust than an egg. Egg ना half a egg cell है. It's mostly water.
Yeah.
तो उसका सर्वाइवल थोड़ा सा डिफिकल्ट होता है. इट्स मोर फ्रेजाइल स्ट्रक्चर.
सर्वाइवल से क्या मतलब है?
सर्वाइवल से मतलब है कि मैंने स्टोर किया, फ्रीजिंग के बाद वापस जब लेके आई नॉर्मल टेम्परेचर पे,
फर्टिलाइज,
इट शुड एक्सपैंड एंड ग्रो.
फर्टिलाइजेशन के
फर्टिलाइजेशन नहीं, एग को एज इट इज मैंने स्टोर किया
जी,
एग फ्रीजिंग में
जी.
जब एग स्टोर किया तो वो एकदम -174 पे चला गया
जी.
अब जब वापस मैं उसको रूम टेम्परेचर पे लेके आऊंगी टू फ्यूज इट विद द स्पर्म एंड टू मेक एन एम्ब्रियो, इट शुड कम बैक, इट शुड रिवाइव इटसेल्फ. तो वो रिवाइवल होगा कि नहीं होगा बैक इनटू ग्रोइंग प्रोसेस, दैट इज कॉल्ड
वेरी डेंजरस.
दैट इज तो बिकॉज एग इज वेरी फ्रेजाइल, रिवाइवल इज रफली अराउंड 70 to 80%. इफ आई एम स्टोरिंग ऑल एग्स, I might revive all, I might revive 5 or 4 of them out of 6. But if I'm storing 6 embryos, there is a higher chance that all 6 will come out. Because it is a complete cell, it has a better stability.
It has all the parts of a cell, mitochondria and...
The nucleus is very stable. 46 is a stable number, stable structure. 23 is a unstable number. Hence the problem is there.
Okay, very good explanation. 100% clear. मेरे भी doubts थे, वो भी clear हो गए. Now, doctor, again, we understand egg, we understand embryo, but blastocyst is still not clear, and it is a very important term and extremely important for survival and for giving a live pregnancy. So we want to understand what a blastocyst is.
Very nice. So you understand that we took an egg, we fused it with sperm, we created an embryo. Now the embryo is in the incubator growing. It will grow from 1 cell to 2 cell. That's called a 2-cell stage. The 1 cell has split into a 2-cell stage. That's an embryo staging timing. कि first day पे 1 cell से 2 cell पे बना. 2 cell से it will grow into something called a 4-cell structure. Then an 8 cell. Further division हुआ cells का. On the day 3, it is around 8 cell stage. Day 4 पे it's called morula. All the cells are now compacting itself.
जुड़ रहे हैं आपस में.
जुड़ रहे हैं. A bunch of grapes like.
अच्छा, got it. Okay.
है ना? और उसके बाद they eventually go into 2 different stages जहाँ पे outer layer जो होती है embryo की वो placenta बनाती है. That's called the trophoblast. And उसका एक अंदर का part होता है जो actually embryo पूरा बनाता है. दिस डिफरेंशिएशन कि हमारा एक बाहर की लेयर बन गई, एक अंदर का एम्ब्रियो अलग बन गया, उसे कहते हैं डे 5 एम्ब्रियो, ब्लास्टोसिस्ट.
अच्छा, ब्लास्टोसिस्ट नाम इतना कंफ्यूजिंग, ऐसा लगता है कोई ब्लास्ट हो रहा है.
सो उसका नाम इसलिए है ब्लास्टोसिस्ट बिकॉज उसके अंदर एक छोटी सी वाटर की कैविटी आ जाती है. इट्स अ वेरी इंपॉर्टेंट स्ट्रक्चर दैट गिव्स अस बेटर क्लैरिटी कि क्या ये हमें प्रेगनेंसी देगा. इसलिए हम हर जगह ब्लास्टोसिस्ट का यूज करते हैं व्हेन इट कम्स टू फर्टिलिटी नाउअडेज. यू माइट आस्क मी, हम ब्लास्टोसिस्ट के बाद क्यों नहीं ग्रो करते?
वही बस पूछने जा रही थी.
सो ब्लास्टोसिस्ट के बाद क्या होता है, मैंने ऑलरेडी एम्ब्रियो को 2 पार्ट में डिवाइड कर दिया है. एन आउटर लेयर जहाँ से वो प्लेसेंटा बनाएगा, एक इनर पार्ट जिससे वो एक्चुअल में बेबी बनाएगा. अब ये जो बाहर का स्ट्रक्चर है, इट इवेंचुअली expands and blasts off to give rise to a small nick in the space to allow that inner embryo structure to come out, called hatching. आप सोचो एक रिंग है, रिंग के अंदर एक छोटा सा बॉल जैसा स्ट्रक्चर है कॉल्ड इनर सेल मास. वो बाहर आता है अपने रिंग में से और जाके इम्प्लांट हो जाता है मदर की वूम के अंदर टू गिव राइज टू द बेबी.
मतलब हम भी हैच होते हैं.
We do hatch.
और हम हैच होते हैं ताकि हम मॉम से अटैच हो सकें.
Very beautifully.
Wow. I love it.
So, and if you are
like
hatching, yes, you are. Free spirit, you are. So,
yeah, I did not know this.
So there's actually a hatching process that happens, and we all hatch out.
Okay. मैंने ये भी सुना है that every embryo is a girl. आप boy बाद में बनते हैं.
Yes, we'll come to that point. It's an eventually.
You were a girl.
Absolutely. Every embryo at one stage is always a girl. That's absolutely true.
Oh,
so जब हमने hatch किया और उस समय अगर मान लीजिए मदर की वूम नहीं है आसपास, तो वो जो इनर सेल मास है उसका कोई लव सपोर्ट एंड न्यूट्रिशन नहीं मिला, एंड वी रियली कैन नॉट ग्रो देम इनटू द पॉड्स एज ऑफ टुडे. हेंस द embryo is lost. It becomes very fragile, very difficult to handle. So as per our today's technology and available circumstances, we take them to that stage where it starts hatching. That's the most advanced stage of a grade A embryo, where we allow it to culture in the lab and then transfer it into the womb to give us the highest success rate of pregnancy.
Okay.
So
बहुत क्लियर हो गया. आप कितना ही रिसर्च कर लो, जब तक आप किसी से ऐसे फेस टू फेस बात ना करो समझ नहीं आता है. It's very confusing. I have always had a great interest in science. मतलब साइंस मुझे ऐसे लाइट अप कर देती है, मेरा मूड ही चेंज हो जाता है अगर मैं साइंटिफिक बातें सुनती हूँ. मुझे साइंस में बहुत इंटरेस्ट है.
Absolutely. Most of us are science, and even today कितनी सारी चीज़ें होती हैं जो स्कूल लेवल पे हम नहीं पढ़ते हैं, नहीं टच करते हैं. And then science is growing every day. Even today we learn so much about neurosciences, the various experiments around it. There's so much happening in the quantum level. So many experiments around us, and there's so much more to learn. The whole science around gut health, the science around epigenetics is growing. There's so much more to science and so much to learn for one who wants to learn. Yes.
So how come every embryo was a girl and some convert into a boy?
Technically, when it comes to genetic organs growing, there is initially all the embryos are, we see XX and XY. These are the two differentiating structures in the chromosome. Out of the 2 X chromosome in a female, only one is X is active. And that X gives rise to the structure of the gonads, or the rudimentary structures in the making of the embryo. When it's growing, there is a gene on the Y chromosome, that is SRY gene. This gene inhibits the structures from growing and allows it to create a male hormone dominance. When it is not present, it does not inhibit the female structures to grow, and it continues to grow. There are cases where the structure is XY. It's technically a male fetus as far as genetically is concerned, but because there is a defect in the SRY region of the Y chromosome, it does not produce the hormones and hence does not inhibit the female hormones. And the fetus continues to grow like a female and makes a girl rather than making it a boy. So all the default setting in the embryo is X chromosome making a girl, and when that default setting is changed by the SRY region of the Y chromosome is when the male gonads start developing, and that happens roughly at the age of 10 or 11 weeks in the fetus.
Okay. So in our case, the SRY gene could not do anything.
Not present because we don't have a Y chromosome. We have only X chromosome. All girls have only X chromosome. There are no Y chromosome.
No Y.
So no SRY region on the Y chromosome and no inhibition of the female sex hormones, female sex organ growing.
If a woman is focusing on her career right now, which is a common scenario these days, what is an ideal age? Because personally, I feel the women I'm watching around me, they are not taking this very seriously. I do not think that women, I think they are all in a happy state and in a hopeful state कि सब सही रहेगा. But I feel कि अगर आप इसको डिले कर रहे हो तो फ्रीज करना चाहिए. तो what is your most advised age कि इस एज तक तो करा लो. मतलब हेल्दी तो ऑब्वियसली जितना यंग हो उतना रहेगा, 20 में करा लो, बट उतने में कोई नहीं कराता. You know it.
Fair enough. So roughly it takes till 30s we are in a good space to understand whether we are getting married or we are planning something else. 30s तक कहीं लाइफ पाथ थोड़ा आइडिया लगने लग जाता है what we are planning in life.
जी.
तो I feel till 30s it is okay. You go around and choose what you want to do. Once at 30, start getting aware. Get an AMH test done. See what your egg quality is like, what your egg number is like.
30 की एज में
30 की एज में एक AMH हो जाना चाहिए.
Right, good idea.
And 30 पे अगर AMH is roughly around 3, stay put. You have another 4-5 years.
अच्छा.
Then by 34-35, if you're still not sure about what's happening next, please go ahead, get the eggs freezed. Don't go beyond 35. At least in Indian females, it gets preponed by 2 years. मतलब 33 I would say technically, but still I would give that leeway कि अगर egg number ठीक है, AMH is around roughly 2s, you can wait till 35 before getting an egg freezed. But yes, don't go beyond that. 35 and beyond, there is a dramatic fall in the egg quality. तो don't wait for 36, 37, 38 to come around to then decide कि अब मुझे करना है, जो कई बार करते हैं. And the most common reason they say is कि मेरे घर में कोई और बीमार था, मुझे कोई और liability थी, professionally I was in a difficult state, I could not take time out. But trust me, यहाँ पे कुछ नहीं करना है, सिर्फ आधी घंटा एवरीडे अपने लिए निकालना है, अपने पास के फर्टिलिटी सेंटर में जाना है, एक इंजेक्शन रोज का लेना है, half a day on the day of egg retrieval, and that is all you need.
Yes, actually, I was going to ask you that. Can you give me a good description of how eggs are frozen so that women are informed? And वो जो एक fear, hesitation, taboo, वो सब वो उसको kill करके आगे बढ़ सकें कि भाई मुझे ये करना है मेरी independence के लिए, peace of mind के लिए.
बिल्कुल. So we are taking good care of ourselves, be it looking good, be it looking fit. हम exercise भी करते हैं. We are looking at a mental state which is good. Sound structure के लिए we are doing meditation and yoga every day. वैसे ही important fertility है. अगर fertility हमें पता है जा रही है तो हमें IVF के नाम से अभी भी टैबू है सोसाइटी में, because the problem is we are not sure कि end result क्या होगा. But not knowing the end result doesn't mean that we don't try for it. हो सकता है कि अगर हमने ट्राई किया तो वी गेट द पॉजिटिव आउटकम फ्रॉम इट. और अब तो बहुत सी चीज़ें इंक्लूड बेटर हो रही हैं इन टर्म्स ऑफ टेक्नोलॉजी. तो इफ़ अ गर्ल कैन टेक दैट इनिशियल करेज which will only come from girls like you who are making these podcasts. You know, women need to educate other women that while we are taking care of everything else, this is also important. And yes, when you do that, you just have to go to your fertility clinic. You have to talk to the doctor, tell them, I want to get an egg freezing done. They will not do anything much. They will simply run a few blood tests on you to see for your well-being, for anesthesia. These are going to be routine tests like CBC, sugars, LFTs and KFTs. And most of them are going to be just okay for you. And then they are going to give you injections daily for 10 days. On an average, plus minus 1 day, that's roughly day 9, day 11. That's all. These injections are subcutaneous injection. developed in a manner so that they can be self-administered by the girl herself. Just like a diabetes patient takes an insulin syringe shot every day, these can safely be taken by you at home also. Or still, if you have that phobia, for a person like me, like I cannot self-inject, I can simply go to a nearby center, just have a pit stop there, to say that give me my shot for today and go back to work. You don't need to change anything in your day. You don't need to miss your office. You don't need to miss your any activities. You might not do active cardio session, but you can still do light yoga, walking, and you can still go about the same day. Nothing is stopping you, and after 10 days, the doctor will tell you that your eggs have now grown to a mature size. Please come in, we'll give you a short general anesthesia, hardly 10 minutes, do the egg retrieval and send you on your way. Take light rest on the same day. Next day, you go back to your office. That's how safe the procedure is. You're not missing out anything. You're not, less capable in your office. You're absolutely taking all the right decisions.
For egg retrieval, is there some special precaution or anything extra that you have to do a couple of days before the eggs are retrieved from your body?
So technically, no, you're taking daily shots. There's one trigger shot that you're taking for 36 hours prior to the injection of the day of retrieval. That can be at odd hours, say 12 o'clock, 1 o'clock, depending on your clinic, what time is the egg retrieval process.
Okay.
But apart from that, you simply, one day prior, you go about your day just as usual you do it. You come back, have your dinner early, a little early by 7 o'clock, 8 o'clock, go to bed. Early in the morning, on the day of surgery, you don't have anything to eat or drink. That is the only level where you do a little bit of fasting, and you go to your clinic, get the procedure done, and you're out.
Very important question. Is it painful to retrieve eggs?
Absolutely
on
not.
the day of your surgery?
So it's usually anxiety that I see in most of my women who come to me, be it married women, be it unmarried. Most of them are anxious on the day of surgery. Like all of us are. There are some palpitations, some things going on that what is going to happen, I don't know. It's all lights around me, those shiny tables and that OT theater area, and everything is a bit alien to us. Scary, very scary. Your doctor is usually there to hold your hand there and tell you it's going to be okay. Most of my patients, they tell me that when I went in, I was scared, but is the procedure done? I never realized it happened. I never knew it. For me, I just went to sleep and I never realized anything was done to me, because that's how it is. You just use a very thin needle, fine needle. You use it to retrieve the fluid that is there in each of the shell of the egg. And within there is a small tiny egg that we usually cannot even see by naked eye. We use a microscope to look at that egg. So that's how simple a procedure it is.
And when she gets up, she doesn't feel any pain.
There's usually no pain. There might be some heaviness in the lower abdomen, which usually goes about in a day or two. There is no cut. And most importantly, there are no stitches to be removed. Nobody telling you what did you do,
stitches.
Why do you have a plaster, or why do you have a stitch. Nothing is there.
Nothing.
Absolutely.
Can tell that you just had a procedure.
Absolutely nothing. Nobody can tell you that.
And this is going to really help them. Really help a lot of people.
So you don't even have to sometimes tell your family members, because at times there are people in the family who might not understand them. Although nowadays we see parents more and more aware about these things and themselves coming in with the kids, with the girls, saying that we want to get this done and we are there with our daughters. And sometimes the daughter is all alone saying that my parents are yet not on the same page, but I am old enough to take that decision.
Can we leave a phone number of yours in the description of the video so that girls can contact you?
Absolutely, you can do that.
Some helpline or something.
We have our helpline numbers. We'll do that. We'll give you the details. You please put them up. As of today, I'm with Birla Fertility. So Birla Fertility has its clinics across India. We have some 50 centers. So you may find a Birla there. You may find some other good fertility center close to your place. Please go out there. Talk to your fertility doctor. It's very simple.
Okay. And other injections, because this is something I've read online in comments, people talking. Are the injections painful?
So
since they are
injected in the skin. So anything that's
in the stomach.
And see, anything that crosses the skin barrier is going to pinch. And depending on the quality of injection, there might be a little irritation around that pinch for some 15-20 minutes. That is usually observed. But some very good quality injections might not even have that. And other than that, there is no pain around it. But yes, you can say there was some bruising around my site of the injection. We do hear those complaints. That's okay. That's a very small thing. It's just like you were going around the room, you bumped into a table, you had a small bruise. Yeah. It usually subsides. You hardly pay attention. So it's up to you. What do you want to pay awareness to? What do you want to put your attention to? And apart from that, some females have said that, we had a little decreased energy in the day. That could happen by day 8 or day 9 of the injection, because you're taking hormones. They do trigger some emotions in you. They do cause a little bit of mood swings. I don't deny that, but that can happen otherwise because of your menstrual cycle. You're already doing that. That's a very small price to pay when it comes to really ensuring that you have a fertility when you want to have it. So as far as those are very small,
allowing yourself that window.
Yes, I feel that. Even when you want to lose weight, it's never easy. You still have to motivate yourself. You still have to sweat it out. You have to bear the pain of pushing another push-up or another squat. So similarly, it's with any procedure. Yes, there is bound to be some very short-term side effects, but they are not going to really make any of that suffer you during the day or have regrets later on, or even long-term side effects, something like cancer or something. None of them are there. These injections get flushed out of your body by the next day within 24 hours by your kidney. Hence, they have to be repeated every day.
Okay.
Otherwise, we would have given you one shot and asked you to come back after 5 days. There are some of those available, but they're not very successful ones. Hence, we give these injections that are actually flushed out of your body
every day.
And you have to hence take them every day.
Important thing to know here is, and I'm asking you this, is that are these injections gonna worsen the conditions of endometriosis or PCOS or fibroids, anything like that? Do they worsen it?
So technically and evidence-wise, they don't. When you take them for one cycle, for example, you're only doing an egg freezing process. You are taking the same hormones that are there in your body at an exaggerated or augmented dose. So they don't impact at least the PCOS or the infertility or the egg quality or even the egg number. Technically, every cycle, your body selects a cohort of eggs. They might be 10 as per your age at 30, or they might be 6 as per your age at 35. These eggs were destined to mature, one of them, and rest 5 were already predestined to degenerate. What I am doing is I am using that opportunity to not let them degenerate,
pulling out all
of them. And hence I am not taking out anything extra from the body. What is there in the pool is going to stay there in the pool. They are not going to be exhausted later on. I am only using them that the body has given me.
So hormone was already present, but it was only enough to sustain one. So you provided extra so that the rest can also survive.
Absolutely. That's all. If there is a barrier, there is a FSH window level that only this much FSH is present, and that allows only one egg to grow.
Okay.
When I give it in a higher dose, all the others also start growing.
So it's safe for endometriosis, PCOS,
Absolutely.
Fibroids, polyps, everything.
When we are looking at a multiple number of cycles, say 4, 5, then yes, because we are taking estrogen on a prolonged basis, we are giving hormones on a prolonged basis, it might flare up endometriosis. It might make some endometrial polyp to sprout up. But otherwise, most of them on a short course, 1 or 2 months, don't cause any problem.
Okay. And usually how many cycles does a woman have to go through?
Again, a question that depends on your age, on your AMH. At an AMH of 0.2, you might be going for oocyte pooling. You might be advised 3 or 4 cycle of egg retrieval by your doctor to use your own eggs. Or you might be 20 and you have a PCO structure. You only do 1 egg pickup and you have decently good number of embryos and you use them to create pregnancy. Having said that, what we have seen in my own experience is that when I go for one cycle pregnancy, success is roughly 60%. To ensure pregnancy, I usually ask my patients to be prepared for a 2-cycle IVF process. Usually that is good to give pregnancy to 80 or 85% of the population. There are some 10-15% people who might need a repeat IVF cycle.
Okay. So if, let's say there are 5 embryos frozen with you, you will transfer 2 and chances are roughly around 70%?
60 to 70%.
60-70%. Okay, let's say she wasn't lucky and couldn't get it. Now you transfer another 2. Now, is it 60 plus 60?
Absolutely. It's cumulative.
So it's 120%. That means...
No, it's not 60 plus 60 in that sense. It's like out of the... So take it like this. There were first 10 females. I transferred 2 embryos to all of them. 7 of them conceived. 3 did not conceive.
Yeah. Right.
Out of those 3, the probability of them conceiving is now 70% again. So 2 of them would again conceive, 1 would technically not conceive. And so hence only 1 would need that 3rd IVF cycle. Most would conceive. 9 out of 10 would conceive out of those 2 cycles of IVF.
Got it. So that means if you are freezing your embryos and you get 2 cycles, you're technically sitting at a 90% percentage.
Absolutely, yes. That is what we've seen in our clinics. People
90% is pretty good.
Is good. Most of the patients do conceive. So usually why I say that is because IVF cycle is not only therapeutic, like you conceive a pregnancy, it also tells me a lot about your body. For example, we've done an AMH, it comes out to be good. I have done your tubal testing, it turns out to be okay. I've seen your husband's sperm, it's okay. I make an embryo. I realized during the process when I'm doing the egg retrieval, I found the egg quality is actually not good, even though the AMH was good. I realized the egg is a problem. I might suggest some alternative medicines to you before going for a second cycle. I have diagnosed the problem, which I had no other way of diagnosing till I have not done an IVF and retrieved the eggs outside the body. Similarly, I did a fertilization. I realized there was a problem in the fertilization. The conversion of egg and sperm to embryo has not happened. There's a problem at the level of fertilization. I may need to work on some other level of the problem in the subsequent cycle. Hence, every IVF cycle is an opportunity to learn more about the couple rather than just giving them an IVF process itself. How the embryos are converting, how the embryos are growing from 10 embryos on day 1 to 2 embryos or 4 embryos on day 5. What am I having? After studying them genetically, do I find a problem there? There's so much more that we can understand when we are doing an IVF.
So day 3 embryo and day 5, which is a blastocyst, there's a huge difference in the quality.
There is 10% difference in the probability of it giving a pregnancy.
Only 10%?
Only 10%. 10 to 15 is all. Because why I'm saying that, at day 3, I have 8 embryos. I select 2 out of them. At day 5, out of those 8 embryos, 5 or 4 have only gone into a blastocyst state. Rest have not grown. Hence, there's a natural selection happening in the embryos. So those that were not good enough are now not available for me to transfer. So the chance of selecting a good embryo at blastocyst stage is very high. Hence the probability of giving result is high. It is not the embryo that has changed. It is only my selection has changed. It has allowed me to select a better quality embryo out of all the available embryos.
Your natural selection has happened and your choices have decreased. Now you're only left with the
best
strongest fighters.
Yes. Survival of the fittest.
Yeah.
Yes, absolutely, that's happening. So I'm not doing anything extra at that point. And at the same time, because it is now just 1 day away from hatching out and then implanting, I have that opportunity to allow it to hatch out immediately after I put it in the womb. And hence the probability is a little better.
Till now, we haven't spoken really about the health of uterus and the role it plays. Like there are so many conditions with a uterus, so many things that can go wrong over a span of 30 years of a woman, that I think it plays an important role. So how do you, okay, you've frozen a very good embryo, everything is fine, everything looks rosy, good, semen is perfect, everything is good. But now when you come to the stage of transferring and you see there are growths in a uterus that should not be there, then what do? Like, how do you ensure that you still get a healthy pregnancy out of that uterus?
Okay, so there are different ways the uterus can have a problem, and the growth can be either in terms, so mostly let's stick to structural abnormalities. There can be congenital abnormalities that the cavity is split into two, or there is a septa, commonly called Hindi mein parda in the cavity, or the cavity might have a growth in terms of a polyp. These all are space occupying lesion within the cavity. The very room where the embryo is supposed to come in and implant itself is now being occupied by somebody else.
But they're very small, no?
Embryo is small, but it needs its space.
No, I'm talking about these growths. They are very small in a uterus,
It
right?
depends. The uterine cavity is 5 ml. The whole space is very narrow. And there can be structures or septa that can create an occlusion there. आपको अगर घर में आना है और आपके घर में कोई ऑलरेडी बैठा है, would you be comfortable enough to come? There is a decreased chance that you're going to be comfortable, and hence the pregnancy chances goes down. If a polyp is there, I'm not saying that pregnancy cannot happen, but the chances of pregnancy happening can decrease because there is somebody sitting there and causing a different environment inside the house now. Why would the embryo feel safe to implant itself? It might get a good space, it might not get a good space.
तो ऐसे में आप क्या करते हैं?
So we go in the cavity, we remove the polyp out. There's no medical treatment to it. We simply have to go surgically take the embryo, surgically take the polyp out and make the cavity back to normal, restore its original structure and come back to then do an embryo transfer in the next cycle.
How about fibroids?
So fibroids again are of different types. There are sometimes a fibroid that's outside the whole uterine wall, and these are called subserosal fibroid. They can be as big as 4, 5, 6 centimeters, not disturbing the actual main structure of the uterus, and hence
6 centimeters,
6 centimeter, 8 centimeter, 10 centimeter also. And that can be there. Usually, if it's bigger than 6 to 8 centimeter, most of the doctors take it out.
Achha.
But till the time it's 5 centimeters or less, doctor won't bother with it, especially if it's outside the uterus, not disturbing the cavity. It will say, ठीक है, दीवार के बाहर है, हमें तंग नहीं करेगा. It is when sometimes the fibroid is present within the cavity, in the wall of the cavity, pushing the wall inside the cavity of the uterus, distorting the whole space. There are times when the cavity is absolutely S-shaped cavity, distorted, the right wall is coming in, the left wall is coming in.
ये यूट्रस की बात हो रही है.
ये यूट्रस की
टेढ़ा
मेढ़ा हो जाता है. बिल्कुल वो एक नॉर्मल कैविटी जो होनी चाहिए, ब्यूटीफुल इन्वर्टेड वी शेप कैविटी, yes, वो शेप चेंज हो जाता है. And that is when sometimes it's a difficult thing. There are expert doctors nowadays available with laparoscopic and robotic surgeries happening. We can take care of them, though there is a small space that, yes, we can never predict how the scars would turn out to be. Most of them do turn out to be okay, and we are able to do the transfers and get a pregnancy. Yet there are conditions where we need to go for extreme measures like surrogacy also.
And where do we stand as Indians on this case of surrogacy?
Okay, so Indian law has now come into picture since 2021. There is a beautiful law that Indian government has now come out with. And so initially we were a hub of surrogacy. There were so many surrogacies happening. People from foreign used to come outside India and come in and get surrogacies done. Right, left, center, people were doing surrogacy. Now law says commercial surrogacy is no longer available in India. We cannot ask women to sell her womb to us and say that we'll pay you give us a
grounds
child.
Of ethics.
Ethics are bigger. Women abuse were happening such at a bigger level because of this, that for some amount of money they were doing all the fact. Nobody was taking care of them. The children born out of them were abused and everything that was happening. So it's a very good thing. It's nowadays only lawful surrogacy is when a woman is ready out of her moral binding to you or out of her willingness to be a surrogate mother. Usually somebody from the family who agrees to it can go for a surrogacy. You can ask her to allow the embryo transfer to happen in her womb and then play a role as a surrogate.
So there's absolutely no chance of asking somebody outside your family to be a surrogate.
No, you
for
can ask the other person, and you can go ahead and get the documents ready. The law is
But you
now
can't
not
pay
facing, but you're not going to pay them. Yes, you're going to only take care of their bills of the medical aspect and the delivery aspect, but you're not paying them any compensation for the fact that they are bearing a child for you and acting as a surrogate.
Why would somebody do that? Why would somebody do that outside the family, especially?
Especially, yes, we understand.
And even inside the family, it's such a big yes. It's not an ordinary yes.
It is not ordinary, but that is the only way the government had to ensure that the women's safety is taken care of. Women were not abused because of that. Because then where does government stand?
What about women who actually are going through something like this and it's not a choice they are exercising, they're pushed into it, their body is not ready and they willingly want to be mothers?
That's true, but you have a certain structure that you need to operate on. We are not individuals, and when we go through the right government status, we do find help around us and we are able to go through it. But yes, what is there is there. You cannot ensure individual success or individual things to be met when we're looking at the society at large.
Is surrogacy still happening? Do you know people who are still being able to get a yes?
Yes, it is happening, very much happening. People are coming in with somebody from the family or otherwise, and that is happening in India, very much happening.
It's so unbelievable. Because, I mean, it's not just about going through something for 9 months. It's also about, it's life-altering, body-altering forever.
There are women who are donating uterus. There are cases of uterus transplantation. There are many more things that happen in society at large. And so what drives who and what emotions are there, it's definitely a complex part. But yes, life does continue. So I suppose that's how it is.
Now let's talk about money.
Okay.
We haven't spoken about the cost of this treatment because this is something that plays an important role while making a decision whether to get this treatment or not. How much does it cost to get one cycle of IVF?
Again, you're looking city to city differences there, but yes, on an average, I would say 2 to 2.5 lakhs is for one cycle IVF treatment in India at present, which includes fertility injections, blastocyst, freezing, thawing, all the medicines, drugs around it. Yes, that is there for a decent, good IVF cycle.
So that means if, like you said few moments ago, that at least 2 cycles are required. So that means looking at spending 5 lakh rupees or something.
Yes, we are. Roughly 2 cycle IVF. There are better logistics available, better finances available at that end. But yes, a good 2 cycle IVF somewhere cost around 4 to 5 lakhs. Sometimes even 1 cycle can cost you up to 4 lakhs.
Why? How is this price changing?
So there are a lot of, in every industry, there are variations available in terms of what you're ready to invest. We have fertility injections from different brands. Some of them have been recovered from the urine of a menopausal woman, filtered, and the concentrated available molecules from there collected to make the injections. That is one aspect, one way of doing those injections. Second way is genetically engineering those injections in the lab. So the technology is different, hence the cost of making those injections is different. They can cost, a total cost of injection in an IVF cycle can range from 30,000 to 70,000-80,000 to 1 lakh, depending on the brand of injections that you're using or your center is using. And also with that 30,000 brand, you will have certain side effect like itching and like problems related to probably decreased response from the ovaries, not good quality eggs. There are variation in the response, but injections costing 80,000 to 1 lakh will give you a more stable response, less of a side effect, less of irritation, ease of administration. Those things will make it cost higher. Similarly, a lab that is taking meticulous care of itself, ensuring that they have filters, they have German quality stuff in their lab, the media they're using are of highest quality, will ensure that the cost per cycle will go up because these medias are costly. But a lab which is using a media which is not of that same grade will have a lower cost of IVF. And that's the most important part. Then the kind of services your doctor is giving you, you can have the same services in a dispensary and you can have the same services in a corporate hospital. The things would change there. So these are different ways in which the cost around the treatment
can go
changes.
up and down.
That is how. But yes, there are certain things which are important because the quality of the labs matter. The service and all are just for our own ease and comfort. But what is important is for the lab to be good. The kind of equipments they have in the lab, the kind of technicians, the person behind the microscope is very important. And that is where I think the difference does come in.
Okay. So it's important that you, even if you have to shell out extra, you go to a good lab.
Good. That's the most important part.
And cost is increasing every year.
It is, yes.
High pace.
So everything is, it's all a cycle. It's not that cost is increasing because the industry people want to increase the cost of IVF. It is because the raw material cost is increasing, the shipping cost is increasing, there is a gradual increase in the currency and everything hence goes a little bit more costlier. It's to that pace.
I get it. Okay, so we are clear on the cost part, and there is also an element of rent.
But apart from that, you should understand the cost has actually become more competitive. Same things were being given probably at a lesser available spaces, hence a fewer IVF centers, more monopoly and higher cost. Now the cost has come down so much because right, left and center you see IVF labs. So people will think that we want to attract more clients, we want to attract more patients, and they might decrease the cost. And again, the whole industry goes for a toss because some might compromise on the quality, others might not. Hence, it works both ways. Sometimes I feel the cost could have been much more, but because the competition is so tough there, sometimes the cost does have to be low.
And then you have to pay every year for the storage.
Yes, renewal of the embryos is merely a small cost, but that's because the lab is maintaining the conditions for the embryos to continue. Although the embryos are left undisturbed, they can be left undisturbed for 10 years, 15 years. I then take them out and plant them. They will react just as beautifully as they would have done on day 2 of freezing. And hence, it's just that maintaining those conditions in the lab is the only cost that you're bearing.
Okay, which is about 15-20K?
Yeah, roughly something like that in the different labs, yes.
Okay. So many celebrities are conceiving in late 30s and 40s. How is that happening?
So some of your celebrities have actually come out and talked about the fact that they've undergone egg freezing. You know, there is a long list. Priyanka Chopra was there. There is so many TV actors. They've themselves come out and talked about it that yes, we got the egg frozen and now we've conceived in late ages because we had that decision done long back. And I think that's a beautiful thing that they do to raise the awareness because we have a habit of looking up to these people to find influence and to influence our decision making. So that's a good thing. That's one way of doing it. Definitely, if you have eggs stored earlier, you can easily undergo IVF. Then there are people, now see, nobody will talk about them, but definitely sometimes you have money, you have the time, you can go ahead for multiple rounds of IVF and get eggs made. Take the best ones out and use them.
It's painful, no? So many rounds.
We've just done, it's not really painful if you really look at it. When you're getting PRP therapies done for your hair and you're doing facial treatment done and you're doing Botox, those are equally painful. So then in front of them, this treatment is really not that painful. But it's ensuring that you conceive. And then there are options of ovum and sperm donation that's available for cases where that's really required. But then again, that's a choice that's very personal to the couple.
Where is law on this? If you take a donation of egg and you put that fertilized embryo inside your body and you give birth, whose child is it?
Law is very clear. It's your child. You've undergone a lawful donation of egg from the mother or the sperm from the male, and the embryo is made. Law is very clear. The party who has now taken the donated embryo and given birth, the parent who is conceiving it are the lawful parent to the embryo. Most of the cases, it's anonymous donation. The donating party doesn't know whom they are donating their gametes to, and often hence there is no claim ever done. Yes, at times there can be there is known donors that one gets from the family, and yet they cannot claim because lawfully it is always by paper. We make the paperwork done and ensure that the couple who are now conceived are the lawful parents there. The law is very clear there.
But the child will not have mother's DNA. Or will the child have DNA because the child was inside the mother for so many months?
Okay,
the blood.
Very good question. I will take 2 minutes here.
I'm confused and I'm asking you.
So if I talk about आम भाषा में हम जिसे genes और DNA कहते हैं, let's talk about DNA. What is DNA? DNA are blocks of repetitive some patterns information. तो आप उसे coiled structure की तरह देखते हो. आप मानो 5 ब्लॉक है, उनको बार बार एक के ऊपर स्टैक कर देते हैं तो DNA बन जाता है. 99.9% DNA is same between all the humans.
Oh, and that is why we are humans.
That is why we are humans and not monkeys or apes.
Okay.
And it is that 0.01% that's different that makes us different from the one sitting in front of us. And the only difference usually that is there in terms of our facial feature or our personality per se. If I group up 100 women from India, especially the northern India, Delhi NCR more specifically, and take a skyline view, and I put 100 women from the American background and they take a skyline view, I can see some observable differences there. Probably in the height, in the looks, in the way they dress up. But beyond that, if I broadly look, all of them would appear more or less same to me. है ना? That cohort will still be somewhat similar. Similarly, you are just little bit different. There's only one expression of gene that has changed in you and given you your unique feature. When an embryo is made from those set of parents, there are at times siblings who are world apart. You cannot say that these two are siblings. Because that embryo that is formed is a complete new structure. Crossing over has happened between 2 different set of chromosomes to create one new embryo. हमें लगता है ये हमारे बच्चे हैं, हमें हमारी genes हैं, but so many, if we trace our ancestry back, most of our genes would be shared. कहीं ना कहीं तो वो किसी 8th, 10th, 11th नंबर पे जाके उसके बाद वो डाइल्यूट होनी शुरू हो जाती है. बिकॉज देयर इज समथिंग लाइक दिस कि बियॉन्ड 8 नंबर अगर हम जनरेशन पीछे जाएंगे तो वो डाइल्यूशन होना शुरू हो जाता है एंड देन वो सब पूल एक ही है. तो ये जो कॉन्सेप्ट है ना कि ये हमारी जीन्स हैं, हमारी मदर की जीन्स नहीं है, मेरी जीन्स तो इसमें इस बच्चे में नहीं है, ऐसा कुछ होता नहीं है. मैं आपके ही आसपास, आपके ही हो सकता है किसी एंसेस्ट्री के किसी उसका डोनेशन ले रही हूँ, मुझे भी नहीं पता, आपको भी नहीं पता. सो दिस इज वन पार्ट ऑफ इट. सेकेंड थिंग, क्योंकि डीएनए अब हमने ये देख लिया मोस्टली सेम है. सेकेंड पार्ट देखिए कि जब मैंने डीएनए बनाया, वो डीएनए में ऑफ स्विच ऑन स्विच ऑफ करने का ऑप्शन है. जैसे अगर हमने क्रिसमस ट्री लगाई, लाइट्स लगाई, तो लाइट्स स्विच ऑन कर सकते हैं एक बटन दबा के. ऐसी जीन्स स्विच ऑन या स्विच ऑफ होती हैं. ओके. द स्विचिंग ऑन और स्विचिंग ऑफ जीन्स डिपेंड ऑन द एनवायरनमेंट इन विच द डीएनए और द जीन इज. अगर मेरा एनवायरनमेंट बहुत अच्छा है तो कोई पीसफुल वाली जीन स्विच ऑन होगी. अगर मेरा एनवायरनमेंट बहुत स्ट्रेसफुल है तो इन्फ्लेमेशन वाली जीन स्विच ऑन हो जाएगी. अच्छा, ओके. तो हेंस मैं क्या डीएनए लेके आई थी वर्सेस मैं क्या डीएनए लेके जी रही हूँ इज वेरी वेरिएबल टू व्हाट इज द स्ट्रक्चर अराउंड मी. तो देयर इज अ पॉसिबिलिटी ऑफ द एनवायरनमेंट टू डिक्टेट द एक्सप्रेशन ऑफ द जीन कि मैं कैसी दिखूंगी, मैं कैसी बनूंगी, मैं क्या हूँ. दिस इज एक्सप्रेशन ऑफ द जीन. And hence when the embryo is in the mother's womb, that 9 months the mother has the ability to influence the expression of the gene to create an embryo that might be different from what I have actually implanted. It's all in the expression of the gene.
मतलब हो सकता है कि उस माँ की आदतें बच्चे में आए.
बिल्कुल आएंगी. आदतें तो बहुत दूर की बात है. You give a newborn child to a mother in India and a newborn child to a mother in USA, because the culture is so different, the baby is going to be very different. वो न्यूबॉर्न चाइल्ड एक गीली मिट्टी की तरह होता है. द वे यू शेप दैट चाइल्ड फॉर द फर्स्ट 7 years, उसकी आदतें बिल्कुल वैसी होंगी. वो हमारी आदत है. एक थर्ड पर्सन को अगर ये नहीं पता है कि ये बच्चा आपका नहीं है, वो कभी गेस नहीं कर सकते कि आपका नहीं है. वो सिर्फ ये बोलेंगे कि आपके हस्बैंड के ऊपर जा रहा है या इसकी आंखें माँ के ऊपर है, बट उससे ज्यादा उनके पास कोई तथ्य, कोई एविडेंस नहीं है कि ये किसका बच्चा है. Hence, yes, technically when I talk about markers of parentage that is available, these are some HLA markers that are done to ensure कि ये paternity test में किए जाते हैं. That also has a level or a limitation. But then we need to understand, what are we looking at? Why are we looking for parentage, or why are we looking about genes? These are options that one explores not out of absolute comfort, but when they are faced at such challenges. But definitely, all those parents who go ahead have a bigger impact on their child's life than they think about it. And they do have a very wonderful experience of parenthood beyond that.
You're always so positive.
Thank you. I just find it so relieving when I see my parents on that journey, because sometimes they feel very stuck in life. They have everything. You know, family hai, couple as a couple, they are doing good. They have a good professional life, most of them. And most of them say family bhi अच्छी है, हमारी life में सब कुछ अच्छा है, पर बच्चा नहीं है. And that is when it really, you know, feels very stuck for them कि ये अपनी life में आगे बढ़ना चाह रहे हैं. They are enjoying everything, but with a sense of emptiness, with a sense कि कुछ missing है. Why do they have to suffer that sense? Why they cannot have that independence, that ability to go ahead and reach out and grasp of the situation that they are so longing for?
क्या आपने adoption भी कभी suggest किया है किसी couple को when they've approached you?
करना पड़ता है. And there are times when there are times, similar times when either the egg is not available or the sperm is not there, and the family says हम तो नहीं लेंगे किसी और का. I very nicely, softly tell them it is okay. You don't necessarily have to go through the experience of motherhood if you are okay with that. If you are comfortable not going through an IVF, rather going for a adoption of a baby, it is a beautiful thing to do. Why do you really want to go through the pregnancy experience and then think the baby is mine? बच्चा पैदा करना is just one aspect of it. More important is बच्चा पालना. How are you bringing up that child? That's the most important thing to do.
बच्चे को family भी मिल रही है.
So that's no problem at all. It's if you can do it, why not? What I feel the couples do yet come back is one, अभी भी इंडिया में वो concept है मेरा DNA, मेरे genes, मेरे sperm and egg.
और ये थोड़ा grandparents की तरफ से भी बहुत आता है.
बिल्कुल, that is one thing. Second, more importantly, sometimes or somewhere, the couple is actually looking for the experience of pregnancy. अभी वो common नहीं हुआ कि हम adopt कर लें. Probably sometimes down the line we might stop making chapatis at home and only go for breads in the market. अभी इंडिया में हर कोई घर पे चपाती बनाता है. Scratch from the flour. So similarly, everybody wants to experience the experience of pregnancy, that coming of the beta HCG report positive, those 9 months that a couple goes through, especially the mother goes through, and then the delivery experience. That is where,
it's so confusing, the reviews you hear. Sometimes it's very positive, कि अरे भाई बहुत अच्छा होता है. Sometimes like अरे इतने hormonal changes, हम तो रोते ही रहते हैं, toilet जाते रहते हैं, और क्या.
Absolutely. So that is how, and still the moment they deliver, तो इसमें ना दो चीज़ें हैं. आज से one generation back, the women were not empowered enough to do what they feel comfortable doing or express their creative abilities. Hence, the only thing they had, the way to express their interest or control in life or creativity in life, was to bring up a child. तो उस समय ये चीज़ें ज़्यादा prevalent थी. Fulfill them. आजकल a woman has a more options of growing and expressing their creativity. Hence, motherhood and pregnancy are no longer the only expression of creativity and fulfillment for them. तो इसलिए people are not going in for second or third round of pregnancies anymore so commonly.
हाँ, अब तो एक ही देखने को मिलता है ज़्यादा लोगों का.
तो इसलिए
And a lot of people are choosing not to have babies.
But yes, the newer generation is to having
You know
that awareness.
such people.
Absolutely. And yes, it came out as a, very casual conversations started happening. I still am, I think, a generation older now. I have my family members who are, 5-6 years younger to me. And while conversing with them, I realized, okay, the newer generation no longer wants responsibilities. What is that? Double income, no kids. Dink. So like, okay, great, why not? Enjoy life, travel around, there's no responsibility, and they want to really and that's also okay.
Because, if you look at it, it's actually fair for those people. Why? Because earlier travel का इतना कॉन्सेप्ट ही नहीं एग्जिस्ट करता था. हमारे पेरेंट्स हर साल नैनीताल चले जाते थे.
कहीं नहीं जाते थे. तो इसलिए नाउ देयर आर सो मेनी मोर ऑप्शंस. एंड यस, पहले फैमिली स्ट्रक्चर अलग होता था, रिस्पॉन्सिबिलिटीज, डेफिनेशन ऑफ लाइफ वाज डिफरेंट. नाउ एवरीथिंग इज वेरी चेंजिंग.
So the world has opened up. So many people, and you see so many people traveling. You're inspired, you're driven by their motivation, and people talk कि भाई अब मैं इस साल यहाँ आज इस साल मैं ये वाला कॉन्टिनेंट एक्सप्लोर करूंगा. अब ये आप इंस्पायर होते हो, आप सुनते हो, आपका भी दिल करता है.
So yes, you can do that. And hence, more importantly, not only travel, people no longer, they are focused on their careers. They don't have the inclination towards, devoting their time. Because see, bringing up a child is no easy job. You might take a sabbatical for 9 months and deliver a baby. But what about the next 5 to 10 years when the child actually needs you and you're not available at home? And that situation is where the whole problem is. That time when the mother is supposed to be the only one looking at the child is now gone. The women also says, I want to go out and explore my professional abilities. The family structure is such that, parents, grandparents sometimes are not available around us. And then what do we do?
आप इतनी लंबी छुट्टी नहीं ले सकते.
So it's a different scenario nowadays. Hence, couples want to postpone that decision. But then while doing it, they need to be aware what are we doing. And in case we do change our mind, what is the backup options?
Probably they should save enough money and then decide, because सिर्फ एक इनकम पे घर चलाना सच में बड़ा मुश्किल है आजकल, especially metro cities.
Depends आपके aspirations क्या हैं, or is it only conveniences that you are looking for. For example, at 40s you have a beautiful 3 BHK and you have a sunny windows and beautiful sunlight coming in every day, well decorated house and to the perfect, all the T's and all the I's dotted. And then suddenly you realize and say कि नहीं, कुछ तो हमें से अब मुझे जाके pregnancy करनी है. Because you have to be sure what you want. Don't just follow the crowd saying कि नहीं, that is the only thing that I want, because everybody is following it. Emotions are very much a part of life. There are some who would be okay with no kids and having the comfort of life and yet be fulfilled. So I tell this very important thing to all my clients: sit with yourself. Half an hour away from the chaos, away from the mind that is traveling around busy with the office work, kitchen ka kaam, ghar ki responsibility. Set all of them aside. Find a peaceful space for yourself. Sit and allow yourself to be absolutely peaceful in your own zone, and then ask your questions. Find out. I think this is one time in life, in the history of Earth as a planet, that the vibrations are very high, and it is very conducive to meditate, to raise your consciousness, to find your answers out of your own self. All the answers are there within you. And it is only when you sit quietly in a spot, you stop the chatter outside of you and you go within yourself, that you find what is the purpose of your life. You find what is really excites you. Why are you here? To experience what? And then you find your answers. And if then you realize that I don't want kids, I want to focus on my profession, or there is something that I really want to give out to the society, please go ahead, do it. Then you will not regret it any time in your life. But if your why is not so sure, take that time out. Meditate. look within. That is where the whole world is within yourself. And that every man needs to realize, especially the young kids. I think most of them are now turning in towards this side of life, towards spirituality, knowing that it is the, the manual of life. Knowing how do we take care of our body, how do we take care of our life, what is the way we run our life, those answers lay there. So without the manual, as Sadhguru says, without reading the manual, how can you drive a car? Similarly, without reading the manual or without going within yourself, understanding spirituality and the way your body works, if you go within and you go out and want to drive a car, you're bound to go into accidents. So rather than accidents, be purposeful, be in the right space. That is very important for today's person. That's one thing that everybody needs to understand.
And what about couples where one partner wants it and the other doesn't want it? What do you suggest to such couples?
So I always tell such couples, see, you create your life. There are times when your partner might not be on the same page as you are. You still have to accept it. That's the first step. That it is okay. My partner is not wanting me. I am wanting it. And that is where you start your journey. You simply have to hold that space that allows your partner to come along on the same page as you are. You don't have to criticize. You don't have to crib. You don't have to go around begging him. No, you have to be in your own space, knowing yourself that what I want will come to me eventually at the right time. I may be coming from a space of fear. I may be coming from a space where, because I am in a direction, if I stay positive, I don't allow the situation outside to influence my thoughts around it, which is, I know, a difficult situation, but that is where the meditation comes in. That is where the practice of breath work and positive affirmations come in. If I stay strong within my own capacity, I will create situations outside. My husband will magically, or my wife will magically turn around and join me on my path. This I can say from my experience of spirituality, of my experience of working with couples. There is no point forcing, no point creating a difficult situation for the partner at home. It is best to hold that beautiful space. When you hold an intention, things work out magically for you. That's true for any area of life.
They magically work out?
They do. Absolutely they do. You are simply supposed to hold that intention. See, why you are fearing, because anybody who is thinking the worst case scenario when they are fearing that I want this, my partner is not ready. But they don't know what exactly they are actually avoiding during that space. Life outside is a mirror of what we are inside.
Yes,
right?
I agree.
So if the husband is just a mirror or the other partner is just a mirror, if I am not getting something, it is because something within me is a limiting factor. Rather than blaming the other person, I would work on my own inner structure, and that I can do is by breath work, affirmations, meditations, visualizations, and then allowing that only positive energy to be there within me around that subject.
It's so rare to find a doctor, a person from the background of science, to be so spiritually inclined. In my own experience, I haven't come across many of such people.
No, I think nowadays it's definitely happening. There are so many doctors around who are believing into the science of spirituality, because spirituality is no longer about woo-da-woos and tantric practices. It's more about logical science. Quantum physics is a very much experimented topic, and everything is based on logic. People from the science background did not believe into spirituality because there was no one to explain the science of it. All the experiments are now available. When they are doing it, there are experiments around how the observing of a certain state changes the outcome of a state. Everything is simply energy. Yeah. We are all energy beings. Yeah. So when we allow that energy, how we allow that energy to express itself is how we define our life. So it was initially thought that it is the person who comes first and later on the situations happen. No, it is you who see the situation in your mind first and then the things happen outside. So we are very powerful. It's just that we've not come to realize our powers. There are women who, when they are happy, they can conceive with just a snap of a finger, and they can just go into pregnancy even at 40, 42, 45 with a single egg. Or you don't know what would be the way out. You just have to hold the thought in you. You have to be very sure what you want. In some or the other form, it will come around. Even the impossible things happen.
You're talking, making a lot of sense to me. If there is a woman who's probably right now emotionally really down, maybe let's say above 30 years of age, and she wants a family, she's not getting to meet the right guy, and because of that, she's also not in a position to expect a pregnancy soon, start a family. What would be your 1 or 2, 3 pieces of advice for her to feel good and secure in herself?
She need to understand that yes, if wherever she is because of her own choices. What choices she's been making, she might be making them unconsciously. Maybe not conscious choices. So it is time to step up. Today is a time of technology. Everything is available to you. Understand that help is available. The universe is there to back her up. She might feel alone, but she's actually not alone. And when moment she decides that, things start shifting around for her. She has to take the first step. She has to work on her inner state of being. She has to turn herself around, believe in herself, start loving herself. There is so much of things available on self-love. You accept yourself, people will around you accept you. You will meet the right partner. Today, it's not about being single. It's about being with the right person. And hence, I think there is so much available. Go out, explore your options, get yourself in the right shape. Pregnancy is no longer about a chance nowadays. There is so much technology available. You'll have pregnancy, you'll have kids, and at the same time, you will have a partner. That? Yes, absolutely. I think the way science has developed, one thing, it has not only ensured, when I was, 15 years back in time when I was in my Safdarjung hospital, the focus used to be that every mother who is conceived should deliver a healthy baby and herself be healthy. That was the time when even a single woman who would die out of pregnancy or childbirth was really critically studied and ensured that why did this even happen with so much of infrastructure being around. Today it is a time when every woman can look out for pregnancy for herself. That right to pregnancy is within her hand. I don't say that immediately if you've got an IVF cycle done, you will conceive. There might be some role of an IVF cycle, some role of good food, some role of good nutrition or tablets. And at the same time, it is very important how you manage your inner state of being. The moment you take care of it, everything would turn around.
This is such an important piece of advice.
It is, and most people don't talk about it. So every time when there is a decision to make, sit with yourself, get yourself into a peaceful state and then make a decision, it is bound to turn out to be for your own well-being.
It will be safe to say, that stress actually plays a very important role.
Oh, you've come to the most important part of the whole process. That is where, a couple can undergo 4 cycle, 5 cycle of IVF, but if they don't trust the process, they don't trust the person they are taking the treatment from, they are not going to conceive, most probably. That's the most important recipe. There are women who would say, मेरे को इंजेक्शन से बहुत डर लगता था, but मैंने इंजेक्शन लगा लिया और अब मुझे एक भी इंजेक्शन से फर्क ही नहीं पड़ता डॉक्टर. And then you see that change in that woman, that she is already a changed personality.
Yeah.
To come onto that path, you have to change yourself. There is something within you that is prohibiting you from entering parenthood. Once you give up your old self to become your new self, that is when you enter parenthood. I have seen numerous examples. That is typically the situation, that sentence that comes, and now I know this lady is going to conceive.
Yeah.
Yes.
And it happens.
And it happens. So many times, the moment they stop cribbing कि आज यहाँ दर्द हुआ, आज वहाँ दर्द हुआ, आज ये मसल पुल था, आज यहाँ थोड़ा सा ऐसा लगा, and the moment they say, नहीं, I am fine, doctor, I am very good. And then now she's on the right path. And then there are some who would conceive आई एम स्टिल से नहीं आज तो मुझे यहाँ पे वॉमिटिंग हो गई, ये अच्छा नहीं लग रहा, अभी भी मुझे ना थोड़ा सा पेन यहाँ हो रहा था, आज दिन अच्छा नहीं गया, और दे आर स्टिल नॉट स्माइलिंग एंड दैट इज वेयर आई फील कि क्या फायदा, you've taken all the pains, you've conceived and yet you're not happy, then at least be happy for that moment. So these are few things, and the moment you believe either in the doctor or in the clinic or in yourself, you know that you cannot make the right decision. So sometimes people say मुझे समझ नहीं आ रहा मैं किस डॉक्टर के पास जाऊँ, so I would tell them you go to 2-3 doctors, you explore and then find where do you feel most comfortable, and then whom do you feel will do the right to you. Not because the doctor is going to do a right or wrong, you have that, you are going to ask the universe to give you the right thing. Doctor might still want to do the right thing for you, but आपके लिए क्या सही है वो आपकी universe already orchestrate करती है, है ना. तो I feel this is such a big thing, that trust not in the doctor, not in the clinic, but in yourself, that I am backed by the universe is there for me, universe is going to show me the right path, and then the decision that I'm going to take is going to be the right decision. I am trusting myself.
Yes,
that is when you know that this patient is on the right path, and those eventually conceive and deliver.
Just listening to things like these opens up so many doors. There's a difference that's created.
It's created, and it's time when we don't operate from a space of logic only. We allow our emotions to come along and guide us. Emotions are guidance, basically. They tell you when you feel happy somewhere that this is a right place to be. If going somewhere gives you, I tell my patients, that there are times in the journey when patient doesn't feel motivated enough even to come to the center, or thinking about the center gives them jitter or some sort of anguish or irritation. I tell them that day, please don't come. Please take another few days off. You wait for the time when you actually feel happy stepping inside the clinic. That is the day you will take the right decision. I'll be able to do the right thing for you.
Yeah.
So that's how the life is.
Yes. I love your mindset. It's so reliable and so consistent. It doesn't change.
Your emotions are reliable. I am not reliable. Nobody else is. But yes, if you follow your emotions, sitting where you feel happy, sitting where you feel comfortable, that is the right place for you. That is the role of emotions in life. So if something is showing you that this will not be okay for me, then don't go along that path. Wait till the time your emotions are in alignment. You might not still want to give up on that path, but you have to wait it out. Till you feel ki I feel good and I feel motivated to walk on that path, that is the time you take the action. So inspired action is what is the right action.
Jalbazi, harbadi nahi.
Nothing.
Relaxed.
Not at all. Never pays. You might feel that I'm going somewhere, but you're not going anywhere.
Women के साथ प्रेशर बहुत है ना, एज का, ये बड़ी प्रॉब्लम है. उसमें हड़बड़ाहट और घबराहट
नहीं है. प्रेशर, इट्स नॉट अबाउट द प्रेशर, इट्स अबाउट बीइंग द राइट स्टेज. अगर वो देखो क्या होता है, 30 पे आपको सडनली थॉट आया कि आई शुड गेट अ एग फ्रीजिंग डन, और यू आर बीइंग शोन समथिंग अबाउट एग फ्रीजिंग, मीन्स द यूनिवर्स इज हिंटिंग समथिंग टू यू, एंड यू फील कि मुझे जाके बात करनी चाहिए किसी डॉक्टर से, तो प्लीज गो एंड टॉक ना. हर लड़की को वो गाइडेंस नहीं मिलेगी. आपका यूनिवर्स अगर आपको गाइडेंस दे रहा है और दोज एड्स आर पॉपिंग अप, इट इज नॉट बिकॉज ऑफ AI, इट इज नॉट बिकॉज ऑफ दोज रैंडम इवेंट्स दैट यू थिंक आर हैपनिंग, बट इट इज ऑल्सो probably because somebody in the universe is guiding you to please go and have a talk to your gynecologist. Ask her questions, at least find out. You might then want to still go ahead on that thought, or you might want to step back. Where is the problem?
हाँ, इस तरह कभी सोचा नहीं कि अगर कोई ख्याल आ रहा है तो कोई सिग्नल है, वो
कोई सिग्नल है, आप उसको फॉलो तो करो. वो किस तरफ टर्न करेगा, आपको उसके बाद क्या नेक्स्ट सिग्नल आएगा, वी डोंट नो. But that moment, that signal has been given to you for a reason. And the best part about that signal is also because कि आप कितने happy state of mind में हैं. अगर आप हर समय गुस्से में रहते हैं तो प्लीज अपने सिग्नल को मत acknowledge कीजिए. Because then there is a higher chance that you are not getting the right signals. You are also attracting the same frequency back from you. So hence हमारे बड़े बूढ़े हमेशा कहते थे कि गुस्से में कोई डिसीजन नहीं करना चाहिए, कोई प्रोमिसेस भी नहीं करने चाहिए, और कोई एंग्री डिसीजंस भी नहीं लेने चाहिए.
हाँ, there's a quote, no, that never promise when you're happy and never decide when you're sad.
Sad. For the same, because you're not in your best state of mind.
Yeah.
One has to be in the very peaceful, still state of mind to make the right decision next.
How do you stop yourself from becoming a helicopter mother? Like, I've heard this about women that they just cannot control their urge. They stop focusing on themselves and they devote their entire life to their child.
It is the guilt that drives them.
I don't know.
They feel कि नहीं, हमारे पेरेंट्स ने अच्छा काम नहीं किया, हम तो अच्छा काम करेंगे, हम बेस्ट देंगे. हमें लगता है कि हम बच्चे को खेलने को स्टफ दे देंगे और वो रोएगा नहीं, तो वो बेस्ट है और वो हेलीकॉप्टर्स मदद कर रही है आसपास. एंड यू रियली कैन नॉट डू एनीथिंग. इट्स पार्ट ऑफ योर ग्रोइंग अप प्रोसेस.
तो आप कैसे रोकते हो खुद को? क्योंकि मुझे यकीन है आप नहीं करते होगे ऐसे.
नहीं, मैं उस स्टेज से निकल चुकी हूँ. आपने किया? I have been through that stage. I was fighting my own battles at that time, so I probably did not do a very good parenting job. Sometimes I feel that, but again, there is nothing right and wrong. Actually, it's wrong to even criticize yourself. But yes, अब मैं बहुत bother नहीं करती हूँ. मुझे लगता है कि kids should be given the difficult situations, should be shown the right way, but at the end, you cannot control anybody's life. These are not your kids. They are not your property. You can only give them a right opportunity to grow. If they do so, it's their life. They don't, it's okay.
तो आपने अपने आप को रोक लिया कि
करना
मैं अपनी
पड़ता है.
लाइफ पूरी तरह खराब नहीं कर दूंगी ऐसे.
बिल्कुल. Because at the end of the day, there is no end to it. आप कब तक लाइफ रोकोगे? तो इसलिए I think that is somewhere where every mother finds her own balance in life. वो आ जाता है टाइम के साथ ना कहीं आपकी इनर स्टेट आपको बताती है कि ये बहुत हो गया, मैं बहुत परेशान हो गई. अगर आप कुछ भी कर रहे हो with a happy state of mind, then you're on the right path. Again, the same dictum applies.
That's true. I'll ask you something that I've heard and bothers me a lot. क्या not having a child क्या एक औरत को कैंसर के लिए ज़्यादा प्रोन बनाता है? Different types of cancers that are only restricted to women?
So yes, some of the uterine cancers or the endometrial cancers are prone for women who are nulliparous, that is, who have not given birth to any kid any time, has higher levels of estrogen, no role of progesterone in their life. Conditions like endometriosis also happen because of the same reason. Unopposed estrogen in the body causes these things, and hence that is the correlation there. I wouldn't say they are prone to it. I would rather say if they are maintaining their health and well-being, it is not necessarily cancer would happen. It is just saying that when we are doing a demographic study and I look at women who have and who haven't, what was seen in the terms of the status of children in their life. So there are women who have had children and the chances of them having a uterine cancer would be lower. This is merely a correlation also, not necessarily a causative factor. So not having children and then feeling scared that now that I have not had children, I would be at a bigger risk of cancer is not the right way to do it. There are more tests available. Go to your gynecologist routinely and get those tests done. You are in a safer space to know whether you are at risk, or if there is a risk, you can take care of it early.
Okay. How many times a year?
Till the age of 35, once in every 3 years. Beyond 35, once in a year is more than enough.
तो आप cervical cancer?
Cervical cancer के लिए pap smear is advised. And for endometrial cancer, a simple ultrasound looking at the endometrial lining is enough. If anytime there is an episode of irregular heavy bleeding or there is an episode that your endometrial lining is turning out to be hyperplastic, that is more than 12 mm, 13 mm, that is when you say that this woman is at risk of some sort of a cancer and we need to be sure about it, and they take a biopsy sample from the endometrium, small office procedure, and you send it for evaluation, and it turns out you get to understand if there is any risk or not. Okay. Even before the cancer happens, there is a 10-year window period when there are some metaplastic changes happening and you can catch it there.
I heard about it. Yeah. So I just had a podcast with an oncologist.
Oh, yes.
And he's very good. He's worked at AIMS. He did his entire education from AIMS. Now he's working with Fortis hospitals. So he told us, पहली बात तो एक उन्होंने myth burst की कि biopsy से लोगों को लगता है कैंसर स्पीड से बढ़ेगा. It's not true.
Absolutely. It's just a method of detection.
और उन्होंने ये भी बताया कि cervical cancer के लिए you can detect it 15-20 साल पहले.
Exactly, yes. There are metaplastic changes that happen 10 years, 15 years, sometimes even 20 years before the actual cancer happening. Hence, we recommend a simple test of cervical smear. That is absolute pap smear, commonly called pap smear. They take a spatula. उससे ये पता चलता है कि क्या वो early changes cell में आ रहे हैं. We study the cell under the microscope. It's a very simple spatula that they use. They take a few cells off your cervix, absolutely non-painful. और उसको जब टेस्ट करते हैं लैब में तो सेल्स में कुछ चेंजेस आने शुरू हो जाते हैं. Those are called changes that come before the actual malignancy happens, pre-malignant conditions.
इसको रोकें कैसे कैंसर को फिर?
अगर वो पता चल जाता है तो देयर आर ट्रीटमेंट ऑप्शंस कि जहाँ पे वो सेल्स हैं उन सेल्स को हम रिमूव कर देते हैं तो फर्दर कैंसर आने के चांसेस नेग्लिजिबल हो जाते हैं. वी टेक केयर ऑफ कैंसर एट अ वेरी अर्ली स्टेज.
तो बहुत इंपॉर्टेंट है फिर, बट अवेयरनेस नहीं है लोगों को इसकी.
दैट इज वेयर इट्स वेरी इंपॉर्टेंट टू स्प्रेड अवेयरनेस. अवेयरनेस, वी आर ट्राइंग टू स्प्रेड अवेयरनेस अबाउट द सर्वाइकल वैक्सीन. वी आर ट्राइंग टू स्प्रेड अवेयरनेस अबाउट द सर्वाइकल कैंसर्स, adequate ultrasounds post menopause also, because then ovarian cancers can be detected only then. So routine checkups are important for that point of view.
कोई नहीं कराता था ना पहले,
अब तो कराते हैं. Mostly
कराते हैं लोग.
Panels have the hospitals have panels and everything. So it's good to get yourself checked once in at least a year or 3 years till the age of 40, and probably once every year beyond 50 to ensure that you are in a good space. Yes, definitely.
What are those 2 or 3 things that you can suggest a woman to maintain her fertility?
Okay.
For a longer period of time.
So yes, age is something that's not in our control. Let's focus on things that are in our control. One, staying healthy. With what I mean by staying healthy is in an optimum state of health is exercising regularly, at least 4 or 5 days a week. No alcohol, no smoking, eating healthy foods, avoiding junk, frozen, pesticide food, or food that are coming commonly out of a packaged material. These are typically things that we all know, and we should refrain from it. If you're indulging in them once in a fortnight, that's okay, but then not very on a daily basis. That's one aspect of it. Second thing, ensuring that whatever plastics material you're using around in your home, be it in your water bottle or in your fridge or in your kitchen, ensure that they are BPA free, because these small things individually might be okay within the necessary limit, but when you do a cumulative study of where the phenols are or where the phthalates are, they rise to an extent that it starts causing inflammation in the body. So if you're feeling good and fresh every day on waking up before going to bed, that means you are in an optimum state of health. That is most important. And third, very important, taking care of your mental well-being, doing some sort of a yoga practices or breath work, or ensuring in some self-help sessions with somebody or on your own. That is the most important third aspect that I tell every woman. That beyond nutrition and food, the third is the emotional well-being.
Could there be something specially for men?
Yes, so men absolutely are nowadays aware, and fertility is shared equally between the men and the women. It is not the burden that is mostly carried by women. It is only the age that is the thing that they are at loss of. Otherwise, even in males, the fertility do decline beyond the age of 40. And there are changes in the sperm DNA levels that cause difficulty in conceiving. At times, whenever a couple is finding it difficult to conceive, it is very important that both the male and the female go in for testing on the very first visit. And the whole journey is taken together. At the same time, it is important to focus on the smoking habits and the drinking habits. Many a times, the males simply say, somebody else smokes so many cigarettes, yet they conceive. So why is smoking a problem? But then when we know something is a problem and it causes free radicals in the body, why do that? Especially if you are struggling around it. So one should indulge it into a certain limit only. Yes, taking care of not wearing tight undergarments which can compromise the blood supply to the genitals, ensuring keeping a healthy and a hygienic genital area, avoiding prolonged standing, because when there is a prolonged standing, there is pooling of blood that can start happening in and around the inguinal areas, and something called varicocele can develop. This can cause problems in the quality of the semen sample, and the sperm can be of a lower quality, and the sperm production also goes down. So that's one thing that they need to look out for. not taking testosterone injections and other substances, especially in the youngsters who go to the gym and they take these drugs to, build the body, show off and have fun, but then they backfire like anything. So we have so many clients who, initially were bodybuilding or in that area, and then later on coming because now the sperm count is poor or there are problems in the semen sample. Hence, these are the few things that we really don't know initially about, and then we realize that yes, this is happening.
Yeah.
So,
okay.
Absolutely.
Unique. I never heard about these things.
Oh yes, they are very common. Especially those men who go to gym regularly, especially in their adolescent years. They start from 18 and 28. They want to build body, go in for their championships and all. And invariably, they take injections because they want to support the muscle mass, muscle growth, any sports for that matter. And that does have an absolutely bad influence on the
there are several professions where people have to stand all day.
Yes, so it does make an impact. One has to know that there are proper supports available that they can use that will not cause such a problem.
So you should sit down every hour or so, take a break.
And take a break, or ensure that your muscles are doing good. You are exercising regularly. Your hip muscles, these are in good shape to support that from happening.
Okay.
Right nutrition does make a role.
Thank you, Dr. Shilpa. It was an absolute honor to have you here. I learned so much. My doubts are cleared. I cannot possibly think of anything that's unanswered through this podcast.
Thank you so much, Alina. You don't know how much I enjoy doing this session with you. For me, everything is a success when out of it comes out fun experience. So I really enjoyed it. I want the young girls out there to be made aware about a lot of things, and I think what you're doing is a fantastic job. We really need more women out there doing this so that the right things can reach out to most of the people.
It's very important for me to make this awareness come across and let people know, and especially women know, that they have the reins of their lives in their hands, and it's not all, their biological clock is not a ticking time bomb. They can, to some degree, they can definitely have some control and make right decisions at the right time. Do not delay, because it's important for women to enjoy, some women and most women enjoy pregnancy, to enjoy motherhood
at the time when that's best suited for them, not in a rush of life.
Yes, correct.
Absolutely.
And career is very important for us now.
It is.
We want to do something, and not just because we want money, but also because we want to create value.
Yeah, absolutely.
We want to be known for our work.
Known for our work. We have so much talent within us, which we can express. And see, you look at so many celebrities. Everybody is doing everything. Life is not in one dimension. We want to experience the whole 3-dimensional and 5-dimensional aspect of it. We want profession. We want personal life. We want a family. We want to celebrate all the festivals with all our loved ones.
Yeah.
So why not? We want family with our profession, and so having it at the right time. See, today it is not the era of just knowing. It is about knowing and choosing on our own terms and condition. If we don't do it on our terms and condition, where is the fun of it? If we're able to control what we are putting inside our body, if we're able to control how we look and how we put ourselves out in the general public, then we should have a control on our fertility also. And that control is now being offered to us through the science. And so we should take it. We should use that to our own advantages. So, yes.
So, loved creating this awareness with your help.
Thank you.
There are going to be some important phone numbers and email addresses down below in the description of this video. If you want to reach out to Dr. Shilpa, please feel free. Allow her some time to get back to you, because probably it may be difficult to respond to all the queries at once.
Will try to do my best.
Yes, please allow her some time, and I can vouch for her guidance, for her knowledge and the expertise. She is one of the best we have in this country today. So go ahead, ask your questions, ask for your help. Thank you.
Thank you so much. It was really a pleasure connecting with you.
Same here.